I tried to ask him. I
I bet we could. I bet we could. I bet Monique could. Yeah.
All right, Mike, are you ready? There was once a king who was only 12 inches tall. Terrible king, great ruler.
Okay, we're in the intro, Kate.
You gotta let us at least hear from the beginning. What is it?
Oh, there was once a king who was 12 inches tall. I just giggled.
Need a drum set to.
Bum, bum.
Now, it reminded me, Mike had a joke, you know, which knight invented the circle?
Now, which of King Arthur's knights?
Which of King,
Round table.
excuse me, which of King Arthur's knights invented the round table? Circumference.
That is another.
My son would love that, so
30
I am going
seconds.
to use that later. So
Good.
thank you, Mike, for that.
Okay, it's been a month, a year since you've been able to tell jokes.
20.
Going on. I appreciate getting back to a little bit of levity.
Oh, absolutely. I'll bring my book.
10. 5.
Good morning and welcome to the March 24th, 2021 Board of County Commissioners meeting. I'm Kate Flavin, Public Information Officer with Sedgwick County. This morning we are streaming our meeting live on KPTS Channel 8. We are also on Sedgwick County's website, sedgwickcounty.org. You can also find the meeting on our Facebook page and YouTube channel. Commissioners still have plexiglass barriers dividing them. We are socially distanced in the room, and then we are also wearing our masks. This Saturday, I would like to remind everyone, Saturday, March 27th, our partner Hunter Health is hosting a vaccination clinic for anyone age 18 or older. So from 10 a.m. until 3 p.m., by appointment only, you can go ahead and get your COVID-19 vaccine. So check availability and schedule your appointment with Hunter Health at hunterhealth.org. You can also find more information on our social media pages as well about this event. And then along with that, remember that the health department is not the only place to get your COVID-19 vaccine. So visit vaccinefinder.org to find a provider near you. And you can also search the website by the vaccine brand or the manufacturer. So if you would really like the Johnson & Johnson vaccine or Moderna or Pfizer, you can search by vaccine, and there's a search function, and so you can check between 10 miles near you, 30 miles near you, to find a vaccine provider that is close to you. On the agenda this morning, Commissioners, we have meeting minutes, appointments and resignations to various boards, 2 items related to the Housing First program. We're revisiting the low temperature disaster declaration. There's items from 2 bid board meetings. We'll also have a review of CARES and COVID-19 spending, and then we have a discussion on the local health order. So, Chairman, I know it's a busy meeting this morning. I'll hand it over to you.
Okay, thank you, Kate. Good morning to everybody watching on KPTS and YouTube and Facebook Live. This time we'll call the meeting to order of the Wednesday, March 24th of 2021, Board of Sedgwick County Commissioners. Madam Clerk, first item, please.
Invocation to be observed by a moment of silence. Please remain standing for the flag salute.
Thank you. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, Madam Clerk, next item.
Roll call. Commissioner Lopez?
Present.
Commissioner Dennis?
Present.
Commissioner Howell?
Present.
Commissioner Cruz?
Present.
Chairman Meitzner.
Present. Next item, please.
Public agenda.
Commissioners, you received a number of emails in the public agenda. Does anybody have any comments on any of them? Commissioner Dennis.
Thank you, Mr. Chairman. I did read each and every one of the emails that we received, and I am a little disturbed with a couple of the emails because they dropped an F-bomb about every fourth word, and I don't think that that is appropriate communications. I know that we normally make a motion to receive and file, but I don't think those even belong in our file. So I'd make a motion that we receive and file all except for the two emails with all of the F-bombs. Thank you, Mr. Chairman.
Okay. Any other comments on that? Yeah, those were kind of pretty vicious language. I know everybody's had a lot of emotion on a lot of stuff, but that had a lot of language in it. Commissioner Howell?
Thank you, Chairman. I also read all of the comments. I would just say those particular two didn't really advocate for any type of policy change from the county commission. It was just really just someone exercising, I guess, a place to express a lot of comments that have nothing to do with what we do here. So I would second the motion.
Okay, there's a motion and a second to approve the emails that we received on the public agenda minus the two that had language that was not acceptable. Commissioner Cruz?
So do we just trash their comments?
Well, we don't I think they wouldn't be published in the minutes as part of the minutes. I don't know if they trash or not, but they don't become public in the minutes, according to the motion.
So the issues that they raise in these are related to the jail. Is there a way to maybe address them with this person to see, maybe to calm them down? Is there a way to do that?
Yeah.
Could we share them with?
Yeah, communications, can you share those two with the Sheriff's Department? Okay, they will do that.
Okay.
Okay. There's a motion and a second. Any other comments? Madam Clerk, call the roll.
Commissioner Lopez?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. Motion carries. Okay. And then do we have a public speaker today? Okay, we do. We have one signed up for public speaking to us.
Should have, Chairman.
I'm sorry? Oh, okay. He's...
Andrew, are you on the line?
Yes, I am.
Okay. Andrew Crane, welcome to the commission meeting. State your name and address, and you have 5 minutes to address the commission. Good morning.
Okay. I'm Andrew Crane with Guiding Paws ICT, 700 North Market is the Guiding Paws' office here in Wichita, Kansas. I am here today to talk to you guys about an event that I'm going to be doing in November, and inviting you guys to this. This is going to be for Wichita businesses and Sedgwick County businesses also, and wanting to invite you guys to that. And then also, on a side note, thank you guys for updating your guys' website and everything to help out the blind community. Job well done. And thank you for changing that and helping out the disabled community and that. And I would like to see a little bit more from you guys helping out the blind community and the disabled community. And I was also wondering when you guys were going to get with the city of Wichita on bringing Amtrak into Wichita. I know Mr. Pete Meister, when he was on at City Council, he was working on this digitally. And I know that I heard that Amtrak was going to be able to come into Wichita, and Union Station was going to be back open. So my question to you today is, are we going to see some help from you guys?
Andrew, this is Pete. Thanks for bringing that up.
Yeah.
we are still working on that. There's city representatives, and I'm working on it with KDOT and ODOT, Oklahoma DOT, and other cities along the route. And I think it's got support for, especially if Amtrak shows up the way they're talking about showing up financially. I think it has support of the commission. So we're working on it. It's not there yet. It's been a long haul, but it's not going away. Okay.
All right.
Hold on.
Good.
Hold on just a minute, Commissioner Dennis.
Yes.
Well, Andrew, welcome. I wanted to tell you that I appreciate your feedback on the website and the other things that we have done to make sure that Sedgwick County is accessible to everyone. And what I really want to do is say thank you to Tanya Cole and her staff, because they're the ones that have been working on this, and they appreciate the guidance that you've given them, because we that aren't hard of with vision problems don't recognize sometimes some of the issues, and the work that you've done with Tanya Cole and the rest of our staff has been invaluable to make sure that we are accessible. So thank you for helping us there, and thank you for Tanya Cole and her staff. Thank you.
Okay, thank you for the comments. All right, Andrew.
Thank you very, very much.
All right.
That's it that I had, so thank you.
Okay, have a good day. Be safe. We'll talk to you later.
You too.
Thank you.
Bye.
Okay, that's the end of the public comment. So, Madam Clerk, next item, please.
Consideration of minutes. Item A, regular meeting minutes of March 3rd, 2021.
Commissioners, if it's all right with you, if we could combine A and B for the regular minutes meetings of both March 10th and March 3rd. So if there's any questions or corrections, if not, I'll make a motion to approve items A and B of the minutes of March 3rd and 10th.
Second.
It's a motion and a second. Madam Clerk, please call the roll.
Commissioner Lopez?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. Madam Clerk, next item, please.
Appointments. Item C, accept the resignation from LaShonda Garnes from the Sedgwick County Community Correction Advisory Board.
Mr. Papoon?
Thank you, Mr. Chairman. Mike Papoon, County Councilor. Got a number of appointments and resignations today, and so hope you bear with me, but we can handle items C and D together. Ms. Garnes has been very active on both the Community Corrections Advisory Board and the Juvenile Corrections Advisory Board. And as you know in your backup, she sent you a resignation letter, very well written, and is asking now to resign from those boards for her personal reasons, and would ask that you accept the resignation of Ms. Garnes from Community Corrections Advisory Board as item C, and the Juvenile Corrections Advisory Board item D.
Okay. Yes, and LaShonda Garnes has done a fantastic job in our community for a number of years, and I think she's had a chance to move on and advance her career, and we will not see the last of LaShonda Garnes. She's an asset for the city and the community. So without there doesn't look to be any other comments, so I'll move that we accept the resignation of LaShonda Garnes on items C and D.
Second.
Motion and a second. Madam Clerk, please call the roll.
Commissioner Lopez? Aye. Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Madam Clerk, next item.
Item E, resolution appointing Dr. Jody Fiorini to the Sedgwick County Intellectual and Developmental Disabilities Advisory Board.
Hey, Mr. Papoon.
Yes, Mr. Chairman. This is Commissioner Dennis's appointment to the Intellectual and Development Disabilities Advisory Board. This is a board similar to our Mental Health Advisory Board, only this board reports and gives recommendations to D. Niswonger, our CDDO director. It's a 15-member board. Each commissioner gets 3 appointments. Commissioner Dennis is recommending the appointment of Dr. Jody Fiorini, and we'd ask that you approve the resolution.
Okay, Commissioner Dennis.
Thank you, Mr. Chairman. Well, it's my honor to make a motion to approve Dr. Jody Fiorini to our Sedgwick County Intellectual Developmental Disabilities Advisory Board. She's been highly recommended by D. Niswonger. In addition, I had an opportunity to review her resume and speak with her directly, and she'll make a great addition to that board. So I do make the motion to approve Dr. Jody Fiorini.
Okay, I'll second that. It's been a motion and a second. I don't see any other comments. Madam Clerk, please call the roll.
Commissioner Lopez?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz? Chairman Meitzner.
Aye. Next item, please.
Item F, resolution reappointing Tony Martinez to the Sedgwick County Solid Waste Management Committee.
Okay, Mr. Papoon again.
Mr. Chairman, Mike Papoon, County Councilor. Items F, G, H, and I all involve appointing members to the Solid Waste Management Committee. A number of these had expired. Item F, and I'll handle all these together if it's the will of the board. Okay. Item F is the reappointment of Tony Martinez. This is Commissioner Lopez's appointment to the board. Each commissioner of this board gets one appointment. I believe it's a 15-member board. There are a number of designated appointments, as you'll hear. But there's a resolution appointing Mr. Martinez. Item G is the appointing of Christina Neal to the board. This is the recommendation of County Commissioner David Dennis. Another commissioner appointment to the board. He's replacing Jeff Fawcett, whose term expired on 12/31/20. Item H is the appointing of Tom Jones, who represents a second-class city in position 2 on this solid waste committee. And item I involves a reappointment of several other members to this board. The reappointment of a non-voting chairman, who is Nikki Soisi. The other appointments are the third-class city appointment, a reappointment of Randy Parker. Position 4, unincorporated position on the board, Clement Dickerson, is also a reappointment. Reappointment of the general public position on the board, which is Kay Drennan. And position 6, the citizens organizations appointment, which is Susan Bose, and she was being recommended for reappointment as well. There's a resolution prepared for each of these appointments, and now the resolutions are in proper legal form, and ask that you make all of these appointments.
Okay, Mike, thanks for reading the names of the several individuals on item I, so that way we can all hear and it's for the record. I will defer to, I know we have groups in item H and I, but we also have individuals with item F and G, so I'll defer to Commissioner Lopez or Commissioner Dennis if they want to comment or make any motions. Okay.
Thank you very much, Mr. Chairman. I appreciate the opportunity to speak. I have spoken with Christina Neal, and she is anxious to serve on this committee, so I'm very proud to be able to support that nomination. Since we're all going to lump all these together, I don't know if Commissioner Lopez wants to make the motion or if she wants to make. I'll go ahead and make the motion to approve items Foxtrot through India.
Okay.
Second.
Okay. A motion by Commissioner Dennis and a second by Commissioner Lopez. And again, thanks to all these people that want to serve on these very important boards. I don't see any other comments, so Madam Clerk, please call the roll.
Commissioner Lopez?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner.
Aye. Okay, next item, please.
Item J, resolution appointing commissioners to various boards and committees.
Okay, Mike Papoon again.
Mr. Chairman, again, several appointments here and resolutions for each of these appointments. These are upon the recommendation of the chairman. He is recommending that Commissioner Cruz be appointed to the Chief Elected Officials Board. She would be joining on this board. A previous appointment of Commissioner Howe is also on this board. This is a board that oversees federal funding for the Workforce Innovation and Opportunity Act. There is being recommended today that Commissioner Cruz and Commissioner Howe be appointed to the Criminal Justice Coordinating Council, CJJC, for one-year terms. This is a large board that has a lot of input from law enforcement and judges and our criminal justice system, and has 2 appointments that are to be made by the Board of County Commissioners. The Sedgwick County Law Enforcement Training Center, LETC Joint Board of the City of Wichita. The chairman is recommending that Jim Howell be appointed to this board. This is a 5-member board. One appointment by the City of Wichita on this board and one by the County Commissioners, and Commissioner Howe is being recommended to be on this board. And the WSU Tech Board, also a one-year term appointment. According to their bylaws, city and county each get a member on that board, and the chairman is recommending that the chairman be appointed, Mr. Meitzner, to this board for the one-year term. The resolution is created for all of these positions and ask that you approve the resolutions.
Okay. Is there any questions or comments on these appointments? Thank you, commissioners, for agreeing to continue and to serve on some of these board appointments. So I'll make a motion to approve as presented by Mr. Papoon. There's a motion and a second. Any other questions? Being none, Madam Clerk, please call the roll.
Commissioner Lopez? Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner.
Aye. Thanks again, Mike, for all your work on this. Madam Clerk, next item, please.
New business, item K, City of Wichita Housing First Program Agreement.
Okay. We have Joan Tammany on. There she is. Hi, Joan.
I'm here.
Good morning. Can you hear us?
I can hear you. Can you hear me okay?
Yes, we can hear you, and we can see you. Okay.
Good morning, Chairman. Good morning, Commissioners. Joan Tammany, Executive Director of ComCare. I come before you today with two agenda items related to Housing First. The first is a contract or agreement renewal with the City of Wichita in the amount of $131,964 plus an additional $59,403.98 for a housing eligibility specialist position for a total contract total of $191,367.98. Most of you know we've been working in a partnership with the city for a long time on behalf of those who are chronically homeless and who have a mental or substance use disorder. We're really proud of the Housing First program here in Sedgwick County. It's a nationally recognized best practice that provides permanent housing with supportive services to individuals who meet the federal definition of chronically homeless. The goal is to set these individuals up with permanent housing first and then stabilize other disabling conditions in an effort to assist these residents be successful in maintaining their independent living status. The program funds 64 units in our community, though selection of the housing option is defined by the participant. In 2020, 29 individuals entered the program and another 16 continued their housing from the previous year for a total of 45 housed in total. Funds are used to assist with application fees and utilities as the goal is to be permanently housed. Different with the new contract this year is the addition of a housing specialist, a housing eligibility specialist. Some of the funds that were traditionally provided to ComCare for the housing support are being repurposed in an effort to increase support to the residents in this program. The new position will be the second agenda item I talk about this morning. Both ComCare and the city see the need for this position to provide added support to optimize participation in the program. And while these housing funds to ComCare are being reduced and the repurposed to the new position, there is no funding change in the program as the City of Wichita will add the amount back on their end. This is a really beneficial partnership and it helps those most in need. The agreement it defines the financial relationship between the county and the city as it relates to the funding of the Housing First model. I hope you support the funding agreement and authorize the chairman to sign. And here also with me is Sally Stang, the housing director for the City of Wichita. I know that she was invited to share information on Housing First, and she can answer questions now, as can I, or we can hold those and cover the next agenda item as well. And then take questions. So just let me know how you want to address this.
Well, Sally Stang, welcome to the commission meeting. You've done a wonderful job in our community and in cooperation with some of our people here at the county and our staff and our commissioners. So just want to welcome you. If you want to say anything, please state so, and then we can cover both these items.
Absolutely. Thank you so much for having me here today, and thank you so much for all of your support in our programs that address homelessness and reduce poverty in our community. And this Housing First program is phenomenal. We do, this request to change the funding is because we're looking to leverage federal funding in cases where we can. And the Wichita Housing Board last year allowed for us to prioritize up to 10% of the Section 8 Housing Choice vouchers for those experiencing homelessness. And so we'll be able to leverage that federal resource to provide some of the rent assistance that has traditionally been paid for through the general funds from both the city and the county. And by leveraging those funds creates the funding that's necessary for this additional position that's going to help provide those wraparound services that will help us fully utilize all of the units that are available to this program and to further stabilize those families in the long term. So thank you very much for having us here and considering this item, and I stand for any questions that you have.
Okay, Commissioner Cruz.
Thank you, Chairman. Thank you, Joan and Sally, for being here today. Sally, I'm so glad that you were able to join. I have really enjoyed working with you over this past year. You are a complete rock star, so I just want to give you some kudos. I really feel like this position is incredibly necessary because this is a complex and complicated thing to navigate, and it's very time-consuming for those experiencing homelessness, for those that are needing assistance. So I appreciate you being here. I appreciate all that you do. Joan, you know you're a rock star. I enjoy hearing from you too. So thank you both for being here. Thank you both for working on this program. It is so vital for our community.
Okay, so agenda item K is the first one, and that is authorizing or approving the agreement, authorizing the chairman to sign.
So thank you. I'll make a motion. We're having some sidebar conversations. I don't know if we should wait until those are completed.
Okay. That's a motion.
I'll make a motion to approve the funding agreement and authorize the chairman to sign for letter K.
I'll second that. Okay, there's a motion and a second. Any other comments? Being none, Madam Clerk, please call the roll.
Commissioner Lopez?
Aye.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner.
Aye, motion carries. Madam Clerk, next item, please.
Item L, staffing table change request to add a City of Wichita Housing First Program eligibility specialist.
Yes, this is Joan Tammany again. Thank you. As just discussed in the previous agenda item, we're asking the commission to approve that $59,403.98 for the purpose of the housing eligibility specialist, who will assist the participants in this program with referrals and maintaining stability. So this agenda item is asking you to authorize the addition of one full-time equivalent case manager 3 to serve as the housing eligibility specialist on the ComCare staffing table, and to authorize a reallocation of budget authority in the amount of $59,403 from contractuals in this model program to personnel costs for the position in 2021.
Okay, Commissioner Cruz.
Thank you, Joan. I'm happy to make that motion. I will make the motion to authorize establishment of the housing eligibility specialist to the ComCare staffing table for a full-time case manager, and authorize a reallocation of funds in the amount of $59,403.98 to cover the position.
Okay, I'll second that. Commissioner Howell.
Thank you, Mr. Chairman. Just a couple questions here. Is this position required to manage this program within the county? And since this is something we do with the City of Wichita, is there a requirement for this position?
There's not a requirement for the position, but there is an expectation and a requirement that the person be engaged. And one way to keep them engaged and to keep them housed permanently is to have somebody to support them in that transition and through the course of their housing situation. So if we didn't have the position, we have people that exit the program prematurely because they're not having the support. And the whole goal of Housing First is to stabilize their housing and then to help them connect to services to address their mental health issues or their substance use issues or their other social and health needs.
Is this funded through property tax funds?
I'm sorry, I don't think Sally and I heard that question.
Yeah. Is this being funded through property tax funds? Is that the proposal here?
It's HUD funding, isn't it, Sally?
So this position is being paid for with grant dollar. Okay.
No, actually, this would come off the county's general fund contribution that they make now. That goes to the line item for rent assistance, and we're leveraging the federal funds to be able to provide that rent assistance. So it really still is coming through the county's general fund to fund that position.
Okay.
But it is no additional cost. There's no change to the overall project budget. It's just reallocating it from rent assistance costs contractually through the city to the personnel costs for this position.
Tim Coppin, Deputy County Manager. That's correct. The cost for the Housing First program has always been a general fund expenditure. It was contractually, it was a contractual relationship with the city of Wichita to pay for the housing only. Under this new model, the bulk of it will pay for housing, and $59,000 will pay for a staff person. So it's still the same amount of funding in the Housing First budget for the county's general fund.
Well, since you're at the podium, can someone please remind me, this is a position we've had in the past. I believe that we, for some reason, I think, did something different a few years ago to kind of move this position, I guess, responsibility over to Wichita, or can you please know?
No, this is a new position.
Okay.
It's the program was designed 14 or 15 years ago to rely on referring agencies to provide case management.
Okay.
The goal, again, is to help anyone that's eligible for this program to get connected to services that will allow them to maintain their housing stability. And what we've discovered over time is that sometimes those referring agencies didn't have the capacity or the ability to provide that level of case management. We know that by having a ComCare case manager who's connected into that system in particular is going to be able to follow up better with all of the individuals in the program, help them maintain their housing, and then be successful in the future.
All right. Well, thank you for those answers. And I'm trying to remember the history of, maybe they have this confused with some other program, I'm not sure, but that's fine. Thank you for the answers. I do think this is an important position, so I'll support the motion. Thank you so much.
Okay, there's been a motion and a second. I don't see any other questions or comments. Madam Clerk, please call the roll.
Commissioner Lopez? Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner.
Motion carries. Thank you again, Joan, and thank you, Sally, for joining us.
Thank you.
Madam Clerk, next item, please.
Item M, termination of low temperature winter weather disaster declaration.
Okay. Good morning, Julie Stimson.
Good morning, Mr. Chairman. Good morning, Commissioners. For the record, Julie Stimson, Director, Sedgwick County Emergency Management. Today, I'm asking for adoption of the resolution to terminate the declaration of local disaster issued on February 17, 2021, and extended on February 19, 2021 for the extreme cold weather event. On February 14, 2021, Governor Kelly proclaimed a state of disaster for all counties due to the impacts with water main breaks, the need for warming stations, and the increased demand for natural gas and electricity. It was advised by the Kansas Division of Emergency Management to declare if jurisdictions were taking emergency protective measures and experiencing these impacts of the extreme cold temperatures and wind chills. During and after the extreme cold, Emergency Management was in communication with local municipalities and KDEM. In addition to the economic concern for the increased cost of utilities, reports of damage to both publicly owned and individual households were received. 6 communities in Sedgwick County reported damage to publicly owned property. Damage include bursted pipes, water main breaks, and multiple equipment failures. The City of Wichita and Sedgwick County Public Works also reported damages and costs in snow removal. Damage to publicly owned property estimates totaled $852,100, which is well below the county threshold for public assistance. Unfortunately, the increased utility costs are considered increased operating costs and not covered under FEMA disaster-related programs. FEMA also does not have an individual assistance program which would provide relief directly to citizens impacted by the increased cost of utilities. It is due to this that I request adoption of this resolution to terminate our local disaster declaration for the cold weather event. Citizens, businesses, and local communities are advised to work with their respective utility companies on payment options, as well as stay informed on updates from the state requested investigation through the Federal Energy Regulation Commission. I would also like to share that the Kansas Corporation Commission has a list of available assistant programs by region on their webpage. Utility assistant programs are under the quick links, and their webpage is https://kcc.ks.gov. I'd be happy to answer any questions you may have.
Okay. Is there any questions? Commissioner Dennis.
Thank you, Mr. Chairman. I guess with the termination of this, what kind of programs or what possibility do we have to provide aid to cities like Cheney that had huge increase in the gas prices and so forth? We still have people out there hurting. I don't think most of the people have got their gas bills yet for this month. And so what's the options going forward?
Currently, there's options mostly in the face of loan programs. I know utility companies some are not necessarily being reflected to the citizens at this time. There's been several who've communicated they did not see an increase in their bills as expected. So utility companies are still working through the state. It's just not going through disaster funding to help mitigate the cost going down to the citizens.
Okay. But I guess I still don't know what cities like Cheney can do. Now you're saying that they're going to have to go out and get a loan on this. It looks like price gouging when it went up 600%. Are there no remedies when someone is price gouging a community like that?
That's what the investigation through the Federal Regulatory Commission is looking into. That investigation is still going on. So depending on the results of that investigation may determine what we can do for our citizens and businesses.
So is your organization the one that tracks whether or not that there's some relief based on price gouging, or who monitors that?
That I don't necessarily have. It won't go through FEMA or the emergency management agencies. I'm not quite sure if there is a designated organization that may.
I think it's going to have to be monitored through our counselor's office, through the legal office, and keep track of what happens with that particular suit. Or
well, there's a lot of people that need relief, and it's obviously there was some price gouging when the price of gas goes up $600 per metric cubic foot. So that's kind of crazy right now.
I agree. And I certainly advise citizens to work with their utility companies. Most are developing either payment plans or working with the consumers. And again, visiting the KCC Kansas. Let me get that website again. The kcc.ks.gov, there are several resources on utility bill assistance programs that are available, and it breaks it down into qualifications and how to apply for that assistance.
Okay. Thank you, Mr. Chairman.
Okay. I don't see other questions or comments. Thank you for working through that disaster when it was there, so I'll make a motion to approve.
Second.
There's a motion and a second to approve as presented. Madam Clerk, please call the roll.
Commissioner Lopez? Aye. Commissioner Dennis?
Aye.
Commissioner Hell?
Aye.
Commissioner Cruz? Aye. Chairman Meitzner?
Aye. Motion carries. Thanks again, Julie, for all your hard work.
Thank you for your support.
You bet. Madam Clerk, next item, please.
Item N, report of the Board of Bids and Contracts regular meeting on March 11th, 2021.
Good morning, Mr. Chairman.
Hi, Joe.
Commissioners. Joe Thomas, Purchasing Director. The meeting of the Board of Bids and Contracts, that regular meeting of March 11th, results in two items. The first is the road improvement project. It's called the Contractor Installed Pavement Marking Project. This recommendation is to accept the low bid from Traffic Control Services Incorporated in the amount of $538,967.50. And our last item on this particular bid board meeting is the Granicus maintenance and support for various departments. And that recommendation is to accept the quote from Granicus Incorporated in the amount of $79,812.11, effective from March 1st of this year through February 28th of 2026. I'll be happy to try to answer any questions you may have, and I recommend approval of both items.
Okay, I don't see any questions. I'll make a motion to approve.
Second.
There's a second. Motion and a second to approve item N as presented by Joe. Madam Clerk, please call the roll.
Commissioner Lopez? Aye. Commissioner Dennis?
Aye.
Commissioner Hell? Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. Next item, please.
Item O, report of the Board of Bids and Contracts regular meeting on March 18th, 2021.
For the record again, Joe Thomas, Purchasing Director. This result from the regular meeting of March 18th. We have three items to ask for your approval. The first one is the road improvements. This is the 2021 BM1 overlay project for Public Works, And this recommendation is to accept the low bid from Pearson Construction LLC in the amount of $1,492,472.80. Our second item is the dental products and services for Health Department. And this recommendation is to utilize the MCAP Infuse State of Minnesota Master Agreement. And it's with Henry Schein Incorporated. That one is good through December 31st, 2021. And then we have agreements with Benco Dental Supply Company, Darby Dental Supply LLC, and Dental Health Products Incorporated. These are good through January 31st of 2022, and all of these agreements have 3 one-year options to renew, and they're good through January of 2025. Item number 3, our final item, is the OMD Healthcare Communication Platform for ComCare. And this recommendation is to accept the quote from Health Source Integrated Solutions, and that's in the amount of $28,920 for a period of 1 year, and this has auto renewals for successive 1-year terms. I'll be happy to try to answer any questions, and I recommend approval of all 3 items.
Okay. Thank you, Joe. As presented, you had make a motion to approve the 3 items under item O.
Second.
Motion and a second. Madam Clerk, please call the roll.
Commissioner Lopez?
Aye.
Commissioner Dennis? Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner.
Thank you, Commissioners.
Hey, Joe, 1 second. Everybody okay on your floor, all your staff?
Yes, sir. I'm very proud of the actions of emergency personnel, our sheriff's department, fire, EMS, courthouse police. They did everything to keep everybody calm, and we're happy to report the one person that we had who was in the hospital seems to be continuing to get better. Unfortunately, we live in a world that creates unwanted excitement. So we had our share of excitement, but I believe we're all doing very well. Thank you for asking.
Okay, Joe. Thank you. Extend our best wishes to the staff and our thanks for everybody doing. So thank you. Madam Clerk, next item, please.
Item P, update on the Coronavirus Aid, Relief, and Economic Security Act and COVID-19 spending.
Okay, I see Lindsay Poe approaching the podium.
Make it sound so official.
Yes, you are official today.
Well, good.
Good to see you again, always.
Lovely to see you as well. All right. Good morning, Commissioners. Lindsay Poe Rousseau, your CFO. So it has been about a month since we last talked about our COVID spending, and so I'm going to give you an update on that, and then we are going to talk a little bit about what we know about the American Rescue Plan Act and that additional funding that's coming. So first, we're going to just talk about the spending, like I said. So bearing in mind that our first expense, again, was March 17th, 2020. So just a year and a week ago, we have spent over $100 million related to COVID since then. Precisely $102,650,088. So pretty astronomical. That's up about $5 million just from the last time we talked. So in terms of non-CARES spending, so County General Fund, we are at $8.2 million. Now please bear in mind that at the end of 2020, we were able to do some personnel reimbursement into the General Fund, into the ComCare Revenue Fund, into some of those various funds, EMS, to offset some of the public safety and public health expenses. And so we have since then been able to access that fund balance that carried forward into 2021 to actually do our COVID spending for 2021. So that's why the bulk of the increase has actually occurred there, about $2.9 million. The vast majority of that, since the last time we spoke, is, again, temporary agency staffing. It takes a lot to get those vaccines in arms, and so that's a good thing. But that's just $2.2 million in the last month. We also have spent about $165,000 on plexiglass in 10 additional courtrooms, so that hopefully the courts can start getting back to business and start bringing people in and dealing with their backlog. We've spent another $55,000 on cleaning services and $52,000 for technology for all of those new health department staff that we have brought on. We are still at just under $42,000 in the fire general fund. We're still at $58,000 in the very, very first round of funding that we received, the Coronavirus Emergency Supplemental Fund. So then let's shift to CARES. So, of course, county CARES spending has ceased, right, because we've transitioned to the general fund. However, you have all heard, I'm certain, about our March 12th deadline for our public health and social service agencies, cities, and schools to submit their information. And so we have been working through those final documentation submissions, reviewing them, making sure they all comply. The vast majority have been funded or are in the approval stages to be paid out. However, we do still have a few that we are working with. Unfortunately, not all are going to get reimbursed, and so we'll be providing updates to you on that after we've worked through that final process, and we'll come up with a strategy for using those funds so that they do not go to waste and can be used to support the coronavirus response. So, with that said, we are at $27.3 million in CARES support to schools, cities, safe operating grant entities, and those entities that were recommended to you by your stimulus review team. So, of course, all $5 million went to schools. Cities have had nearly all of their funding, about $14.9 million, paid out. Again, they had the March 12th deadline, and so we're working through those final few reimbursements. Now, there were 80 unique awards that were given to public health and social service entities. As I said, the vast majority of those have been resolved. We still have 7 entities on the list that we are working with. We have paid out about $5.7 million. Now, a good chunk of the $19.4 million that was allocated for public health and social service agencies was for Ascension Healthcare, right? The public hospital. And so their deadline is actually March 31st because the height of the pandemic was really hitting them later than the others. And so we are still working with them. They will be the one entity that goes a bit beyond that, but that was negotiated and changed in their contract. As we talked about before, over 1,300 businesses received safe operating grants. We are in the very tail end of our 10% sampling portion. We do have a few, as I told you last time, where based on some compliance reviews, it does appear that there could have been possible fraud. Those have been referred to BKD's forensic arm to look at those for us. Many of those have been resolved without any issues. There are a few others, and so our colleagues at BKD will be reaching out to those folks to try and sift through that, and I'll keep you posted on that. So with CARES, we started with $99.6 million. We have spent $84.6 between county needs and those external entities. That leaves $15 million to be paid out, but again, over $9 million is for Ascension, and we know that that is still to come. So looking at Spark spending, I am absolutely delighted to tell you that we spent every penny, and I've reported successfully to the state, and they have accepted our report. So that has been tremendous work done by our accounting team to make that happen. So that's some exciting news. So with that, we will move to something. This is actually something that the GFOA, the Government Finance Officers Association, put out earlier this week. I think it does a really nice summary or job summarizing what's coming up with the American Rescue Plan. So I'll just jump right into it. And I believe, Commissioners, you each have a handout of this. So as we all heard, it's a huge amount of money. $1.9 trillion signed into law March 11th. $350 billion is going to states and local governments. $1.25 billion is going to the states. The rest is coming to counties. Every county in Kansas is going to receive a direct allocation, and most likely every city. Now, there's still some computations that need to be done because there are some limitations in the bill, like you can't have more than 75% of your budget given to you. If there's overlapping communities, they're going to take that into account. So we don't yet know for sure exactly how much is going to any single entity, but we do expect, based on projections that have been done, that we will receive just at $100 million, We expect all of the cities right now in the county to receive funding, including the city of Wichita, which will get about $73 million, I believe. And so there will be a significant chunk of cash, about $190 million in direct allocations that we expect to come to local governments in Sedgwick County. Yes, sir.
So other cities, meaning Derby and other cities?
Yes.
Will be receiving something?
I think there's 20 cities in Sedgwick County. Every one right now is listed as receiving some portion of funding in the estimates that have been released.
Commissioner Howell, maybe we ought to have at this next SCAC meeting, maybe a little presentation, if something's not happened before that for the cities, okay? Anyway, if you or somebody could maybe be available for even a Zoom call with the SCAC, with the Sedgwick County Association of Cities.
It would be our pleasure. And I will tell you right now, the state, actually they're doing a terrific job of putting out information and trying to, so I think we've talked before, and I was going to get to this a little later in the presentation, but I'm going to go ahead and talk about it now. So we know that the full federal rule book is going to be in play here. We only had apparently, like I said before, like a third of the rules before, and I thought they were pretty intense. But apparently the next round is even more so. So we actually will have to do federal procurement. So the state has already been reaching out, doing webinars, trying to understand what the needs are from local governments, because what they have at least potentially talked about doing is going out and doing some competitive solicitation for technical assistance. And that way, if there is a single contract, I'm going to use Widow Bryan's as an example. If they put in a proposal and are selected, then every county, any cities who get funding would be able to piggyback on the contract that they do. And so that would allow everybody to get competitive rates. And they've also said very clearly they want to collaborate and partner with so many entities receiving money. The cities, the county, the state. Obviously, we have to avoid duplication of efforts. We have to make sure that people aren't able to use the money for the same expense. And so there is a concerted effort to make sure that we are collaborating and making sure that we're going to be able to do this as effectively and efficiently as possible, especially because you'll see on, I thought it was this slide. Well, in the law, it says that this funding may be used through the end of calendar year 2024. So we will receive our first half of funding sometime this year. The law says within 60 days of the bill being passed, we'll do our certification and get funding. That's a lot of work for the Treasury to do to get money pushed out to, you think how many counties and cities and states there are, tribal governments, in the country. That's going to take some work. So I'm not necessarily holding my breath that it will be exactly 60 days. But that is roughly the timeline that they have put out, that we would get access to our $50 million and then another $50 million next year. We don't know what the certification process looks like. We don't know yet what we're agreeing to, but we do know that this slide shows what the eligible uses are. And so there, I would point to, in particular, C on this slide, which talks about the extent of the reduction in revenue. And so we don't necessarily want to spend everything we've got right at the beginning, knowing that this funding can be used through 2024, and we don't necessarily know what to expect in terms of revenues, particularly with ComCare, as we talked about last year. They were very heavily hit. And so we want to make sure that those services can be sustained. Now, there are lots of other buckets of money that are coming in for services, but we don't know what those are yet. We know there is some for mental health, but again, it's just going to take an intense amount of collaboration to make sure that we can get this in the right spot. So unfortunately, I can't promise an easy next few years. But we do have, if you look at the other options for use, there could be opportunities for lots of good for this money in our community. So the first one is that we can respond to the public health emergency with respect to COVID or its negative economic impacts, including assistance to households, small businesses, and nonprofits, or aid to impacted industries such as tourism, travel, and hospitality. So that is certainly more open-ended than the guidance was with CARES. I think option B is pretty promising. To respond to workers performing essential work to provide premium pay for eligible employees. Now, of course, there are rules that go along with that, up to $13 more per hour, capped at $25,000 per employee. We don't exactly know what eligible employees are. We haven't gotten the guidance. But certainly as we talk about those things, that's an interesting option to be able to have out there for us, at least through 2024. And then we talked about C. And then finally, another intriguing option for us to make necessary investments in water, sewer, or broadband infrastructure. There's also money set aside through this bill, not through this direct allocation like this, but separately for broadband infrastructure on top of this. So I think lots of opportunity, certainly, that we can talk through. So it does have two explicit restrictions that funding may not be used to directly or indirectly offset tax reductions, delay a tax increase, and we cannot use it to support a pension fund. And then, of course, it must be spent by the end of calendar year 2024. So GFOA has put out some key principles that they would like governments to try to adhere to as we begin to talk about how to handle this money so that we are approaching things consistently and fairly. And so you can see, I think number 2 probably doesn't need to be said, but I think it's worth highlighting, and that is this is temporary money, and so we probably don't need to make long-term decisions based on having this funding. We want to make sure that it helps us correct structural imbalances, not create them, by potentially doing lasting changes that are funded through the short term that have the long-term negative consequence. And then finally, we want to make sure that everything is done strategically. And I think this commission did a fantastic job of that. Last year, you gave us clear priorities, you gave us clear direction, and we were able to work off of that. We will be doing the same thing this year. So later this week, the finance group is starting an after-action review with Whit O'Brien's. They're going to lead us through the process, basically to have a lessons learned from CARES so that we can learn from the experiences we've had. And then we also will be conducting a needs assessment. This one, thankfully, we have a little more time. And so we're going to be able to be comprehensive and make sure that maybe those voices that we didn't get to talk with last time are heard. We're going to be able to use data more strategically to understand that maybe if there are areas that are hurting, the data is going to show us that even if those voices don't tell us. And then I know there will be lots of opportunities for collaboration with other partners in the community. So that is what I wanted to highlight. This is all one big receive and file, but I'm happy to answer any questions, and certainly we'll keep you posted as we learn more.
Okay, Lindsay, thank you. Is it anticipated that we would be putting together another committee and Whit O'Brien and things like that?
So what I will tell you is we know there's a resource gap. We definitely don't have the capacity to handle this as we are now. But I have been cautioned because of the federal procurement rules, it's not necessarily guaranteed that we can go with the exact same resources we had. Obviously, we would love that because we've built the relationships. Right. But we'll have to figure out our way through that.
Okay. Yeah, it might have been early for me to ask that anyway, so sorry. Commissioner Dennis.
Thank you, Mr. Chairman. I have two questions. The first one deals with the $99.6 million, which ended up 102, the way I understood your briefing. Do you know how much that we provided to Via Christi, to Wesley, to Rock Hospital? How much went to the different hospitals?
So Ascension has not actually received funding yet. They're working through their monthly reports, but they have just over $9 million that they would be entitled to. Their end date for spending is 3/31. They're the only one who has an extension into 2021 because of the nature of the public health crisis and how it impacted them. So we are still working through that process with them. For Rock Regional, I believe their total award was $800,000. That was what they could have received between two different grants. I'll have to get back to you on precisely how much they have actually received. Wesley did not submit an application, and so they have not received any funding.
Very good. Well, I appreciate that. One of the reasons I asked the question is we're in the middle of trying to get vaccines in people's arms, and got a little bit of information on difference between Johnson County and Sedgwick County on vaccinating the public. And in Johnson County, they've administered a total of 179,000 doses by public entities such as hospitals, doctors' offices, and so forth. And their health departments only distributed 54,000 doses. So it's exactly opposite of Sedgwick County. And from what I've gathered, the hospitals don't believe that they're part of the solution to getting vaccines in arms, and that does concern me, especially when that they've had record profits during the COVID, and we've provided funding out of our CARES. So I would hope that they would think that they're part of the solution of getting vaccines in people's arms. So that's the reason I asked that question, okay? Let's move on to the second question, the last question that I have, and that's uses of the funding. And I've asked this question before, but one of the concerns I've got is with Senate Bill 286. And some of the solutions I've heard on that Senate Bill 286 is that I'll just take the $50 million that we get this year and the $50 million next year and use that to solve that problem. So is there any possibility of using that funding to offset the cost of Senate Bill 286?
Well, I would certainly hope so, but we have no guidance yet that would tell us. And because of the way Senate Bill 286 is written, it requires it to come from the general fund. So we would have to find a pathway to get that funding from the grant fund into the general fund in a legitimate way in order to spend it that way. And so that's actually where I think the trick is that general fund restriction within Senate Bill 286.
Very good. That's all of my questions. Thank you, Mr. Chairman.
Okay. Commissioner Cruz?
Thank you, Chairman. Thank you for this update. In addition to the money that is coming to state and local governments, there's an additional $4 billion that has been allocated for mental health funding. Mm-hmm. So I wonder, this funding is for programs that support prevention of and treatment for mental health and substance use disorders. So how do we plan to tap into those funds?
So I don't know if Tom wants to speak to this. I believe there's going to be two pathways. Let me speak specifically to your question and then more generally. So for those funds, my understanding is that will come through the state when those funds are awarded. And so it would be essentially an opportunity for ComCare to bring a request to you to make application to the state once the rules are put down. So that's generally more. There are lots of other buckets of funding beyond just the mental health and substance use. And so for those things, I do think we want to have a concerted effort because a lot of that can go toward economic development, revitalizing our economy, maybe doing some diversification. And so I think there's going to be a community group that will help steer us through that process, definitely with involvement from county and city. I would say especially county because we've been the ones who've really gone through the COVID relief funding, especially lately. And so I don't know if Tom has any comments he'd like to make.
Thanks, Lindsay. Commissioner, those are good questions. And I just wanted to make a comment just about the management of these fundings as they begin to roll and how it's a little bit different than CARES. First of all, as Lindsay alluded to, many government entities are getting direct funding. There's also private entities getting direct funding within the community. There's for entertainment, for example, certain business designated funds, mental health funds, housing funds. All these streams are part of this huge bill. And so just going into this, I kind of summarize this with 3 words. There has to be transparency. There clearly in this matter has to be coordination, and there has to be accountability. So the coordination part of this is we've had some discussion, and we're all learning as we go again, but we've had some discussion with City of Wichita and other cities within the county and the business community on how we can coordinate, because as Lindsay alluded to, we have a tremendous opportunity here to make a real difference in this community long-term and pivot our business and help our businesses to recover from this year or 2 that we're going to have to go through this pandemic. So we had there was a group that met when the Supermax issue hit Spirit a little over a year ago, and it is a group of community leaders, both and many governments are part of this, cities and county. They pivoted last March when COVID hit and became the COVID task force, and are now looking at a third pivot to become a clearinghouse or a group to help administrate and coordinate all of this funding coming to so many different entities within the county so that we do this together. We don't repeat or have replication. We don't have double, triple dipping. We are coordinated with what we do for our community, and it's going to be a tall task. But this is a great group of people. They've been meeting for many, many months. It's the right venue to have some type of broad sweeping oversight, remembering that at the end of the day, that you as the commission are accountable for the $100 million that the county gets. So there's this overarching coordination that we have to have, but each entity, each government, each business has to be accountable to the federal government for how we spend this money. So we'll need some oversight. We were hoping we could use WIT and BKD and the same partners again, but as Lindsay talked about, there maybe is going to be a procurement issue, but that would be the goal, to have an entity like that working with the county, but also being part of this bigger group to talk about how we manage this money. So it's going to be a very interesting time, very challenging time for our community, but one with a lot of opportunity if we do this correctly. So that's kind of how we're going into this, and we'll of course keep the commission aware of anything that transpires with that coordination.
Thank you for that. One thing, your first bullet point of your 3 was transparency. And last year, with our $99 million, we had a stimulus review team that met in this room, and those meetings were open to the public. Will the COVID task force meetings be open to the public as well, in light of your transparency bullet number 1?
That's a good question, Commissioner. That has yet to be determined. We have the city manager actually, because the city is getting a funding share this year, he's the one that actually suggested that this group be used, and I thought it made perfect sense and supported him on that. I think that we have a discussion with that group about how can we now make this the most transparent, even to the point where we open it up to public meeting kind of environment. Or it could be a situation where we as the county we make our portion transparent through whatever mechanisms that this board decides, and the larger group is more of a working group that this stays behind the scenes, but make sure that we have coordination so that we're not duplicating efforts amongst the community. So that's to be worked out yet, but I think from our end, clearly, and I know Mr. Layton feels the same way, we want to be very transparent with this money so the community knows how it is being spent.
And where is the list of who sits on this COVID task force to ensure that all segments of our population and our community are represented within this group?
There is a communications group, and the Greater Wichita Partnership has kind of been the organizers of that group. We'll get the list from them, make sure it's public. If this group is indeed the group that becomes the coordinating group of this, absolutely we'll provide that to you and to the public.
So if we find that it is not as diverse as we need it to be, who has the authority to appoint new members to this COVID task force?
I think they would take recommendations clearly from any of you or City Council or Derby Council or whoever's already a part of this team. In fact, that very question was asked on the meeting we had earlier this week, is how big should this table get, other people that should be involved. That will all be fleshed out over the next few weeks as we discuss how we're going to manage this.
Okay, so I understand that they will be in charge of the $100 million that we are going to receive at the county, but the question is around, they're going to be in charge of they're going to be looking at the $4 billion that could potentially come for other buckets of money, including the entertainment money and all of that.
Right.
Okay.
The commission will retain its authority to direct its $100 million spending on your priorities. And we would want to make sure we collaborate with that group to make sure there's no duplication or efforts, but you are the steering group for that money. This would be, I think, there's literally dozens of buckets of funding that are potentially out there that we could access, and I think this group is responsible for the coordination of those efforts, if I understand Tom correctly.
That is correct, and we cannot pass the responsibility of accountability away from this commission on our $100 million. You are the ultimate authority on that expenditure. Our only ask is that we coordinate this through the community with this other group, but they, by no stretch of the imagination, have authority over this money, nor will they have any authority over anything that we mismanage in this money. The buck stops at your bench with how that money is spent.
Okay, so just so that I'm clear, the separation, so the 100 million that we get, this group is going to act like the stimulus review team last year. That's my question one.
Okay. I don't see them being that as intimately involved as the stimulus review team was. This group is a more overarching group that we'll be looking at several streams coming in so that we have good communication, and we'll force that communication and coordination to some degree. I don't see them as intimately involved in what dollars go here and there in the final analysis of how we spend money. We may want to stand up our own rendition of stimulus review team for the county 100 million, aside from the bigger group oversight.
So when can we have a discussion around that? I know that those folks who sat on that stimulus review team put in a lot of extra hours. And so, but it was a diverse group of people who understood budgets. And I think that's important because it kind of took the commission. We took recommendations from those who were knee-deep in all of those requests. And I think that's a good layer of transparency for us to be able to acknowledge that needs to happen. So I just wonder, when will that discussion be made? How will those people be selected? And what would be the deadline for that?
Is it okay if I answer that one?
Go ahead.
Okay. Then you can correct me on anything I say incorrectly. So because the federal rule book, the whole thing applies this time, I don't believe that we will be able to have a stimulus review team in the same way that we did before, where it's more ad hoc and we kind of look at things and we have our own priorities. Because we're going to have all those procurement rules, I think it's going to have to be much more structured. So what we really need is guidance from the Treasury on what they're going to allow us to do, how we're going to allow that to happen. I mentioned the after action review, I mentioned the needs assessment, but the other thing that we're getting is training on all of these rules, because we have never had to deal with them before, but we're going to be really smart by the time this is all over. And so we will get that information. Once we have that information and we understand our boundaries, that will be the time that we come back to you. We know that that is a goal of the commission. We know you all appreciated that work at the stimulus review team. And so we will try to find opportunities to do that. That needs assessment is going to be way number one for the community to get involved. And so we're going to be talking with all of our advisory boards, your district advisory boards, all of those groups to make sure that we're hearing as much as we can out of the community. So that is the first opportunity for community engagement, and that's where we will use it. And then hopefully we'll be able to come back to you with a plan in 60, 90 days once we get that guidance.
Okay. And so you'll send the group of...
And the good news with this money, not that CARES wasn't good news, but...
Hold on. I had a question I wanted to ask you.
Sure, go ahead.
So you'll send me the COVID task force is posted somewhere online that everyone can see who's on that group?
Yes.
Okay. Thank you.
Okay.
So you were saying about the money, the good news about the money?
Well, the timeline is not so severe. When we received that money last March and April, we were given a 12/31/20 deadline. This deadline is, we'll be able to manage this more thoughtfully, more carefully. We can have good discussion. We can have debate. We don't have to rush this thing like we did with the CARES dollars. So I just think there's opportunity here. If we just really tap the brakes on this and give this good thought, that there's a lot of opportunity in the community.
Thanks.
Any more questions?
I'm done. Thank you.
Okay. Commissioner Howell?
Thank you, Mr. Chairman. I do have a number of questions. Thank you for the presentation. This is very helpful. First, let me just commend your office and all those involved. I think you've did a wonderful job figuring out how to best spend the previous awards and getting that out to the right folks, and doing a good job of tracking what needs to be done and making sure we do it in a way that's defensible. If we ever get audited, I think we can stand up proudly and say we did a great job on that. I want to just credit you and all your peers and the folks involved in the entire process. They did a tremendous job. So let me start with that.
Pass that along.
I would assume, similar to that, this also would be auditable going forward.
Oh, without a doubt.
If we make a mistake, this would have to be repaid with property tax dollars.
Yes.
Okay. I'm thinking about the things we did over the last year. Again, we had an awful lot of support to a lot of organizations received finances through Sedgwick County, but we also did things like we set up testing, for example. We set up contact tracing. We hired folks at the health department. We've stood up our vaccination program and plan here in Sedgwick County, and on it goes. We helped with PPE. And there's a lot of things I think that were really critical decisions because of the rainy day that we were going through. And I think the rainy day is, I hope everybody understands the emergency of this pandemic is largely behind us. Not saying we're not still some concerns here, but I think right now we're over the hump. I mean, I hope everyone senses that. I think that's a popular opinion. I'm not an expert on pandemics, but I do feel like that our data is encouraging, and I think that we're moving more towards normal every day. Do we know how much money has been awarded to our state, or you've already kind of given us an update on Sedgwick County dollars, and I think we have earmarked the remaining dollars. We kind of know where that's going to go at this point, but do we know what the state's doing with the previous awarded money? Because I understand amongst other states that there's quite a bit of money still out there that has not been allocated towards solutions due to the pandemic.
So, unfortunately, the best data we have is as of September. So I think I shared with the commissioners each time we were doing our quarterly reporting to the feds. Our most recent version of that was due a month or so ago, and so that has been posted, and it shows that we have spent or allocated the vast majority of our funding. Unfortunately, that is not posted publicly right now for other entities. And so as soon as that report is made available, we can tell you with precision how much the state had at the end of the year and how much it had gone through. But I can't tell you that right now. I'm sorry.
Thank you. I'm reading the eligible uses include, and there's a whole number of things here. It talks about assistance to households. Let me back up just for a second. Is the money that's coming to Sedgwick County and to the state of Kansas completely formulaic? In other words, it's not discretionary, it's completely based on a formula.
The amount that is coming to us is formulaic. The way in which we must spend it is not.
We have discretion within our county on how to best spend those dollars here in the county. But in terms of the dollars that are coming to Sedgwick County, no one at the state level or federal level is making a decision on how much to give us. It's all based on formula.
Correct.
Okay, very good. I'm looking at some of the ideas here: assistance to households, small businesses, nonprofits, aid to impacted industries such as tourism, travel, and hospitality. On it goes. I would just say this is kind of like Senate Bill 286 on steroids, because they're providing funding to go to these things that maybe have been impacted by the pandemic. So it's not that they're just providing funding to the county, but they're actually kind of directing it towards those that may have been fiscally harmed through the last year. But I guess my question would be, in light of where we are right now in the pandemic, I'm a little concerned that you're talking about nearly $200 million. And I think the spending, in my opinion, really ought to be tied to the pandemic. It ought to have some connection to COVID-19 and damages that have been felt by this community. Some of the things are listed here, such as investments in water and sewer. I don't know how you make a connection to pandemic with that type of targeted spending. And if someone can help me out there, I would sure love to understand that.
Well, so I think my understanding of this act is that it is focused on the recovery from the impact of COVID, whereas the prior bill, CARES, was dedicated to response itself. So I don't necessarily know that there is a connection between COVID and water or sewer, but I could certainly make a case for broadband infrastructure because everything got pushed to your house. And you have to have broadband at your house in order to remote work or remote school. That would be my only possible suggestion back to you about how those all relate.
It talks about premium pay for eligible workers. I mean, are we talking about providing additional monies now to some of our first responders and folks that were on the front lines of this pandemic? Are we going to provide additional funds to them at this point?
So that is one of the big questions that has come up. I've been on, I can't tell you how many calls now, NACO and GFOA and state, and everybody is wondering, is that retroactive? Is that supposed to go back to the time when they were dealing with response? Because you're right, for the most part, most places have had an easing of the pandemic. And so that is the question is this intended to be able to go back and back pay them, which creates its own issues? Or are we supposed to do that going forward? So I don't have the answer to your question on that one.
Thank you. That's kind of what I was concerned about as well. I guess I'll just say it. I think it's going to be pretty challenging to find ways to spend $200 million that fit within these allowable ideas. Maybe I think it was challenging enough to spend the $110 million we've already gone through. I mean, we did a good job, but we did find, specific things like testing and immunizations and health department staff and all that goes. I think going forward, another, basically doubling that money going forward, it's going to be pretty difficult to find qualified things to spend money on that would get to this level. Are we concerned about that?
No.
Really?
Sorry, go ahead,
I
Tom.
think it's a good question, Commissioner, but we also we really don't know what the future holds, and this gives us a timeline all the way through 2024 where we can kind of read and react how the economy, how the Wichita, Sedgwick County economy reacts to the pandemic and recovery. So we have some time to be thoughtful on that issue. And when you look at it over, I agree if it would be in 7 months, it would be a challenge to figure out how to spend this, but we've got almost 3 years to set back and communicate and talk to stakeholders and figure out a thoughtful way to utilize this money to the benefit of our community.
I have one more question, then I'll make a comment. The last question I have is on item C here. It says, for the provision of government services to the extent of the reduction in revenue from such state, territory, tribal government due to COVID-19 public health emergency. And on it goes, if we had to manage Senate Bill 286 as we've kind of currently understand that, it seems to me that's almost a direct connection to that idea that, again, if we say we don't have the funds because we're now paying for damages to businesses, okay, we're going to reimburse those businesses for their damages, and we're threatened with cutting services, that would not, we would not be able to support those services with these monies, I would think.
Well, so what I understand, and that's why I say I'm not worried about $100 million and spending it because of this provision and reduction in revenue, but the way I understand it is that we take how much did you receive in 2019, the last full year before the pandemic, and compare it to 2020. And so our property taxes did not go down. We're going to have to pay it out, and it's going to be an expenditure. So it's not, if we actually compare apples to apples and look at those revenues, I don't know if this particular provision gives us that opportunity. I think this is more about what can you show that you lost and how can you make the COVID connection. So I'm hopeful we can find, if this bill passes and we do have to pay these damages, I'm hopeful we can find a way to do that under some of these other avenues.
Just a follow-up comment to that point then, I think the argument of 286 is that they say we should not have collected those dollars from, again, we don't really have a way to not collect not to assess those taxes because we didn't have a provision to single out these businesses. But their argument, I guess, is we shouldn't have put the burden of government on their shoulders, and it's unfair for them to essentially, be picked on, and we should not have taken the monies from them, so we owe it back. So if you look at 2020, after 286, there's monies we collected that they're going to say we should not have collected, we have to give it back. Again, so then you look at 2020, after that's over with, and compared to 2019, there is a huge difference. Okay. My final comment would be this. Again, I think every community, every government across the entire nation is going to take this money. But this was highly political, and I feel badly that I think that the most difficult parts of this pandemic, we have worked out ways to get to survive. The communities have done a good job. I find this to be very troubling that there's so much money flowing into the county that essentially is completely federal debt, and essentially is going to be on the backs of our great-grandchildren or maybe even future generations beyond that. I find this to be very troubling. And we're going to take this money, we're going to do a lot of things with it. We might even grow government and create some dependency in the process, which may be problematic in the future when it comes back to our own budget. So I'm very concerned about this. I think we need to be very careful on how we spend these dollars. I know we're going to go through this, and I know there's going to be a lot of folks that are chomping at the bit on how to spend these dollars, but I think we need to be very careful not to have a spending frenzy that we're going to regret later on. That's all my comments. Thank you.
Okay, Lindsay. You have more?
No.
Another section of the, okay.
No, you are all done with me. You can receive and
Okay.
file if you want.
Well, thanks again for the presentation, and I know it's going to be challenging, and there'll be questions to come, I'm sure. So, and I believe that Kate already sent a message over to the director of SCAC saying that we'd be available to help inform at the local level with the other cities. So thank you, Kate, for doing that. So, okay, thank you.
Receive and file?
No other questions? What's that?
Motion to receive and file?
Okay. Second. There was a motion to receive and file and been seconded. Madam Clerk, please call the roll.
Commissioner Lopez? Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner.
Aye.
Thank you, Commissioner.
Madam Clerk, next item, please.
Item Q, discussion regarding COVID-19 order.
Good morning, Commissioners. Justin Wagoner, Assistant County Counselor. I guess first off, I'll just explain that I know that the agenda item title isn't very explanatory. What I'm going to talk through a little bit this morning is, and it's going to be somewhat similar to what I mentioned during yesterday morning's Board of County Commissioners staff meeting, which would be a summary of Senate Bill 40, and then kind of delve into if and when Senate Bill 40 becomes law, how that applies to Dr. Menz's current order here in Sedgwick County. Summarized Senate Bill 40 was a bill that was approved last week by both the House and Senate during a conference committee. Either they came out of conference committee and then approved it. It was presented to Governor Kelly for her signature on March 18th. From what I understand of media reports I've heard either that or read that she either is planning to sign the bill or let it enter into law. Regardless of which of those approaches may occur. I mean, obviously she has veto power, but I haven't heard any indication that that's something that she's intending to do. Assuming that either of those occur, the law would presumably be in place no later than March 31st. Could be, even if it was let to go into law, it would be roughly around March 29th. It becomes effective upon publication in the Kansas Register. And I know they will routinely do special publications if there's a need for that to occur, and I think this is one of those cases where that comes up, it would. So I anticipate that law will be effective by the end of the month. One of the things that it requires that it applies to a bunch of different actors in terms of under the Kansas Emergency Management Act, under public health responses to infectious and contagious diseases. I'm going to focus on how it applies to the county specifically, and also the portion on public health, because that's the statute in the act under which Dr. Menz is acted here in Sedgwick County. It would amend KSA 65-201 to where any order by a local health officer that would be similar to Dr. Menz's current order, including the requiring of wearing of masks or limitations on capacity in a business or movement of people, would have to be approved by a vote of the Board of County Commissioners in order for that local health officer order to become effective. Because Dr. Menz's current order has not been approved by the Board of County Commissioners, because that's not a requirement under the current law, absent any other action by the Board of County Commissioners into the future, any subsequent issuance of an order by Dr. Menz with approval, if and when Senate Bill 40 becomes law, it's our office's opinion that Dr. Menz's current order would be legislatively nullified once the publication of Senate Bill 40 would occur in the Kansas Register. So let's talk a little bit more about how Senate Bill 40 would apply here to Dr. Menz's order and what changes would it cause. I think there's really two key changes. The first of which is it would establish a significantly higher standard for local health officer orders to meet in the event of a court challenge. And it'd be significantly higher than what any courts are using under either the United States Constitution, Kansas Constitution, or current Kansas law. It would change the current Kansas law in a significant way. The second would be it would require an expedited hearing to occur within 72 hours of the lawsuit being filed. With regard to the first of those two, the strict the strict scrutiny standard, it essentially builds that into Senate Bill 40. It's a constitutional standard that's utilized typically for cases where somebody's making a claim that rights enshrined within the U.S. Constitution's Bill of Rights are being infringed upon. Here it would apply that to local health officer order review items such as wearing a mask, social distancing requirements. Again, not a standard that courts have used around the country or in Kansas, but it would be part of Kansas law now. It's a significantly higher standard than what courts use now. The expedited hearing approach, the second major change on that, it's not common for civil lawsuits to have that kind of a time frame for an initial hearing. Lawsuits usually don't have any hearing occur for a number of weeks or months after they may be filed. There's usually time for an answer, those types of things. It sets in place a similar standard to what Kansas law has for isolation and quarantine hearings, where a hearing is required to occur within 72 hours. And the thought process in that context is because somebody's freedom and ability to move is at stake. So it's essentially adopting a very similar standard on local health officer orders, really for any kind, not just isolation and quarantine. So the practical effect of this is that there would be a low bar for someone to be an aggrieved party, because any aggrieved party could file a lawsuit and get a hearing within 72 hours. And it really probably, there's no case law on this yet, it could be as low of a bar as somebody who just doesn't want to wear a mask or doesn't want to socially distance. The combination of that kind of lower bar for an aggrieved party, the heightened standard of review under Senate Bill 40, and the expedited hearing all make it possible, perhaps even likely, that the continued issuance of orders could result in a number of lawsuits, all of which would have to be handled very quickly and could certainly overwhelm the county's legal resources to respond to those lawsuits. And really, to elaborate a little bit further, I think really Senate Bill 40 acts as a bit of a deterrent on counties taking measures to address the spread of infectious and contagious diseases within their county and population. And I'd also point out that Senate Bill 40, as it pertains to KSA 65-201, is not limited to COVID-19, so it really applies to any public health orders that the local health officer may order under their public health powers. There are other portions of the bill pertaining to the governor and also the county's ability to act under the Kansas Emergency Management Act that are specific to COVID-19 response. But I'm focusing more on our current order and how Senate Bill 40 has to keep the discussion, I think most on point to what's most relevant right now. Once Senate Bill 40 becomes law, Dr. Menz could still issue orders. The Board of County Commissioners could still, issue an approval of a Dr. Menz's order, and those orders could be drafted in a way to be as defensible as possible. So it's not saying that couldn't be done. And I think it's worth pointing out that as it stands today, the County Counselor's Office feels pretty confident that Dr. Menz's order under current Kansas law, before Senate Bill 40 would become approved, could withstand legal challenge. But once Senate Bill 40 becomes law, well, nothing's changed under the U.S. Constitution, nothing's changed under the Kansas Constitution. State law would set a significantly higher bar for the county in defending these orders. Potential outcomes in court would not be certain. It's hard to tell. There's not precedent for this type of an analysis and knowing exactly how the court may rule on any orders. I wanted to talk through real quick kind of a non-exhaustive listing of options in terms of what you could do today. And before I do that, I also wanted to add, we've been through this pandemic for a little over a year. Dr. Menz has been issuing orders. None of his orders have been successfully challenged in court at this point, and that remains true today. Some of the options that would be in place, again, there's more than what I'm going to list here, but one would be to take no action. There's no specific recommended action from staff here today. There's no requirement that you have to take action. And I think I've already explained the consequence if you take no action on Dr. Menz's current order and Senate Bill 40 becomes in place, that essentially would be legislatively nullified. The second option would be to, you could approve a draft resolution or an amended, a draft resolution that would amend Dr. Minz's order or approve his order so that it would be in place after Senate Bill 40 becoming effect, or you could do that in the future. Third option would be to make make verbal recommendations as to public health guidance that commissioners would, or the board as a whole, if you wanted to incorporate those, would like to have. You could also have a resolution that would acknowledge the legislative nullification of Dr. Minz's current order by Senate Bill 40, and also just put in place public health recommendations. And I'm going to talk a little bit more in depth about that one because the chairman had asked our office to prepare a resolution. I believe I'd emailed a copy of that to all of you before, but I will pass that out here in a minute. So there's a number, you could have Dr. Minz ask him to pursue a new local health officer order to become into effect potentially after Senate Bill 40 would become into place. There's no specific required action today. There's no recommendation that we have. There's a number of options that you could undertake here. And I'd be happy to answer questions on anything about Senate Bill 40, anything about what your options are. And then before I take any questions, Chairman, if it's okay, I'd like to pass out a copy of that draft resolution as well.
That'd be fine. It's probably worth noting that as of now, there's not, on this date, there's not a regular meeting scheduled next week, Wednesday, the last. And so the end of the month, assuming that the Senate Bill 40 comes in place by the end of the month, we would have not had a meeting before then. And so it could essentially, as you're saying, render the current health order null and void. I did see that part in this. And so my just thought as an option was for the county, we could acknowledge that it may end or likely could end on the end of the month. And if so, based on the Senate Bill 40 that's passing, we would recognize that it's null and void. And with that, we would also, as the Board of Health, we would immediately recommend that as the Board of Health, we could do a resolution strongly recommended, cover the things we've talked about, especially getting the vaccinations, still allow businesses to do whatever they want to do if they want to have masks or gathering orders or anything like that. So, and it would not, this resolution that we talked about that I was discussing would not be in effect immediately. It would be in effect upon the Senate Bill 40 coming into play, which again nullifies the existing order. So that's just some of the background, and this was just a suggestion that is an option for the commission to understand and receive and approve or not. And again, as you've said, we don't have to do anything. If we do nothing, then March 31st will come and go, and it's likely that the current order will be nullified.
That's correct, Chairman. For the benefit of the public, Chairman, I think you did a very good job summarizing that draft resolution. I might just very quickly go through and just expand upon your comments in terms of what the content would be. As was noted, it would signify that the county commission understands that Dr. Minz's current order, if and when Senate Bill 40 is published in the Kansas Register, would no longer be effective. And then, if approved, this resolution would have the Board of County Commission making strong recommendations that the following actions be taken. There's 5 of them. The first would be that individuals become vaccinated against COVID-19 as soon as they are eligible. The second would be individuals generally wear face masks or other face coverings in indoor public spaces. The third would be that businesses and organizations generally require customers, employees, and other invitees to wear face masks or other face coverings in indoor public spaces. Fourth is that individuals would generally maintain 6 feet of social distancing from other individuals unless they live in the same household or are known to each other. And then the fifth one would be that businesses and organizations generally require customers, employees, and other invitees to maintain 6 feet of social distancing. unless they live in the same household or are known to each other. And as the Chairman, as you noted, that the resolution draft would become effective upon both approval of the County Commission and publication of Senate Bill 40 in the Kansas Register. This is just, as the Chairman was indicating, it's just a draft. Obviously, if the will of the Board of County Commissioners was to somehow amend this, that's certainly fair game.
Okay. Any thoughts or questions, comments from the Commission? Commissioner Dennis.
Thank you, Mr. Chairman. Before we get into this resolution that we're talking about, I have one kind of general question, and that's on quarantine. Is there any order from Dr. Menz, from the governor, from any organization whatsoever on quarantine? And I know the CDC put out some guidance talking about 2-week quarantine. If you recall, here a month or so ago, we worked with all of the school districts, and their concern was any time that there's a 2-week quarantine, if someone comes in close contact, then they're sending their students home for 2 weeks. They may not ever come up with any type of symptoms whatsoever. So I don't know if is there an order right now that the school districts have to comply with or the public has to comply with on quarantine?
Commissioner Dennis, that's a very good question. No, there's not an order on quarantine. And I will, yes, you raised a good point there. The term quarantine will sometimes be used perhaps in its generic sense, perhaps the better word that's used, for example, when KDHE may give guidance that people shouldn't travel from place to place would be to say self-quarantine. But a true quarantine under Kansas law or isolation requires an order from the local health officer. And there are not any orders quarantining people. And they're also specific to either a person or a group of people. It's not, my understanding of Kansas law on that is it wouldn't be able to apply broadly to a broad, like the entire county or something like that. The isolation and quarantine powers are specific to an individual or group of individuals.
Okay, so with that answer, what I understand then, and I'm trying to keep kids in school. We've got 2 months left. We need to keep kids in school for the next 2 months. So if a student comes in close contact with another student or a faculty member, which I doubt if should happen because they should all be vaccinated, but if they do, there is no requirement for that school district to send that student home for 2 weeks.
That's correct, Commissioner Dennis. I think anything in that effect has been in the realm of guidance and self-quarantines with very limited exceptions, again, that would have applied to specific individuals. And there aren't, I'm not aware of any current orders that Dr. Menz has issued to any individuals in schools on quarantine.
Good. Because I truly want to make sure that we can keep our students in school and we can get them to graduate for the seniors and the rest of them can complete their year. One minor question on the draft that I saw. It's got an effective date, but it doesn't have an end date. Does that mean this draft, if we approved it, would go on forever?
I suppose it does not have an end date, so that's a good point, and that's an amendment that if you or one of the other commissioners wanted to make that change to the draft, could certainly be done. But at any point in time, you could obviously change the resolution as well, if you would wish to do so.
Very good. That's all of my questions right now. I'll probably have more later on. Thank you.
Commissioner Howell.
Thank you, Mr. Chairman. Thank you for the good explanation of this Senate bill.
Thank you.
I would characterize the two main, you mentioned a couple of main points, but I would like to characterize 2 main points that really caused this bill to happen. And I'll make a number of comments as well. But I think the first point that this bill makes is it forces the elected officials of the county, that's us, the Board of County Commissioners, to establish policies, not giving that over to the unelected appointed officials that we currently have empowered to do that. I think it's a good point. I have tried over the last number of months to ensure that the county commissioners would actually vote for whatever policies we're going to ask our public to follow. I think that's good language, and I support that very much. I think Senate Bill 40 did a good job of making that point. And the second thing it does is it tells us that the people who are aggrieved by these health orders, that they have a need to be heard and have potential relief fairly quickly. And I think that that's also a very good principle, that we should not, establish a health order that we have a difficult time defending, and then people have no options to seek relief in court. If it's a very, very long period of time or the standards are against them, I think that this is good language once again. So it's interesting to me that this bill did pass both House and Senate with very high numbers. It's very bipartisan. And I think that if I was in the legislature and this was before me, I would vote for it. I think this is good language, and I'm glad that the legislature did this. And I have no problem whatsoever with supporting whatever health orders are going to come from Sedgwick County. I think we should vote for those. I'm glad to vote for those and be on record on whether we support them or whatever. Justin, one thing you didn't mention, I think there's a fifth option, obviously, is that is to rescind the health order today or whenever. We have that option as well.
Certainly, that's a good point, Commissioner Howe. I think the under state law, under KSA 65201 and 65202, you currently retain the option to review, amend, or revoke Dr. Minz's order.
Well, just to comment on the chairman's comments, we're not going to meet between now and Monday, and this bill would effectively nullify Dr. Minz's health order. You said no later than 3/29, which is Monday. That's basically the date that would be expected to be in the publication in the Kansas Register. So we don't really have another opportunity after today to actually act on whether we want to actually, definitively vote to change policy in Sedgwick County. We can do what we have been doing, essentially take no action and let things take its natural course through the decisions of other people, the state legislature in this case, and the governor. I would rather have us vote. I think that our constituents and our public deserves a representation that actually is on record of establishing policies in Sedgwick County. I think we should make the call. The pragmatic difference is, possibly today, or we could pick another date, tomorrow or Friday, versus just letting others make decisions for us that might take effect as late as Monday. I would rather see us make a definitive vote and be on record. I think our people deserve that. So I won't do it right this moment, but I have a few other comments, but I possibly may have a motion here shortly that would be in line with that. Let me make a few other comments here. We've heard all along this pandemic that I wear a mask to protect you, you wear a mask to protect me, and all of that. I think that there's plenty of evidence to support when two people wear masks, the mode of transmission is more mitigated. It's less risk if two people are wearing masks versus one. But what's not really stated very clearly there is that when I wear a mask, it does protect me too. And if you wear a mask, it also protects you too. Also, it protects you as well. And I just checked, if you want a better mask, we know that the NIOSH N95 respirators, they're very good and they're readily available. They're all throughout this community. You can find them lots and lots and lots of places in this community. You go out and buy a NIOSH approved N95 respirator mask. There's a principle called personal responsibility and personal freedom, which are connected. And I think through this pandemic, we have looked to others to protect us. And when we have the options of protecting ourselves, that should be our first principle. I don't want someone to put my health at risk, obviously, but if I can do things to protect myself, I should do that. So part of this resolution that's been handed out today, one of the first points on this is we encourage people to get vaccine and to get a shot. I agree with that. I think that's a good strategy. We should ask our people to get the vaccine against COVID-19 as quickly as possible, as soon as they're eligible and that's available. And by the way, later when we get to legislative issues or other in today's agenda, I think we need to contemplate another letter to the governor and to KDHE asking Sedgwick County to move into phase 5 immediately because we have plenty of appointments available. And I think in that line, we need to encourage everyone to get a vaccine and as soon as possible. So I agree with that part. But again, personal responsibility says if you want more protection for yourself, you have options. You can socially distance from other people. You don't have to come near them. You can avoid places where there's gatherings, and you can also wear a better respiration mask. And I think those are options for anybody who wants to protect their own health. And I do think that people have a responsibility, first of all, for their own health. Everybody should make a decision that's best for them. Here we are in this pandemic, and I'm looking at the data on the dashboard, and we have a lot of immunity that's out there. We don't know who has been vaccinated by looking at them. You can't tell. Some people have antibodies, and you can't tell. There's people out there that have assessed the risks, and they don't seem to care too much about getting this vaccine or getting the virus. Maybe it's because they're very young or very healthy, although there are some people in those demographics that actually are harmed by COVID-19. But nevertheless, they make decisions for their own health. And no matter what we do with this health order, there's not a direct correlation between what people actually do. We can say you must wear a mask, and some people are not going to do that. And if we don't have a health order, which we're not going to have apparently after Senate Bill 40 becomes law, there's plenty of people out there that are going to continue to wear masks. So we're not really controlling behavior directly. I guess I would say that. So there's people on both sides of that would do what they want to do because they understand the risk and they make choices for themselves, and I support them in doing that. There is an abundance of data now. We received a very interesting email yesterday. I emailed back and forth with a gentleman with the first name Brad. He presented some interesting data, and I went back and looked at the KDHE website, and they have infection and case charts for every county in Kansas. And the email, I'm sure we all got it yesterday, I'm sure you all read it, makes a connection that there's really not a lot of correlation between counties with mask orders and counties without mask orders and how it affects the trend line data in those various counties. We received an email just this morning, I know you all got it, from the Sentinel. It was forwarded to us. He makes a lot of really good arguments as well. It has some charts in here about masks, about counties with mask orders and counties without mask orders, and the various infection rates. And he makes some great comments in here that there doesn't seem to be a lot of correlation between those health orders and the trend lines. I guess I'm saying this. I think it's time for us to do what we should have done all along. I think we need to push the policy from the county commission. And the right policy for today is to ask people to be responsible for themselves. They have many options for their own health. There's lots of people out there that have immunity, and I don't know that this resolution actually even recognizes the fact that someone may have immunity and really shouldn't even be asked to do some of these things in this resolution. The resolution, in my opinion, is assuming that everyone's at risk, as they have been this entire last year, which is really not true. I think we're telling businesses what we want them to do. And I think, again, businesses have a right to control their own property and make their own policy. So I don't know that I can support this resolution as it's currently worded. By the way, if we're ever going to pass a resolution, I don't know why you would wait until Senate Bill 40 is enacted before you would actually make those recommendations. And why not make the recommendations today? I mean, they're recommendations. They don't do anything, right? So I don't see why you would wait to make recommendations. As we move forward, no matter whether we do it or whether the Senate Bill 40 does it for us, I would ask people to respect each other, to love each other. When you see someone with a mask on, they're indicating to you that they are concerned about COVID-19. Please respect that other person. Don't come near them unless you are going to don a mask yourself. I think that's called respect, and we should do that as a community. There's an awful lot of judging going on. People see someone without a mask on, they make the assumption that that's a bad person because they're not wearing a mask. Could it be that person has received 2 doses of vaccine and they're no longer susceptible to this? And I think that we ought to recognize the fact that some people don't need to wear a mask because they're immune, or they've assessed the risks and they've made a choice that they don't think they need to worry about this for whatever reason. I think we're stating such obvious things in this resolution, it doesn't have a lot of value. We're telling people to socially distance and to wear a mask, and once again, if someone's socially distant, they don't need to wear a mask. A mask is a mitigation if you can't be distant. Well, we don't recognize that truth either. But I don't think we need to continue to preach at people and tell them what they already know. At some point, it's time to stand up and trust our citizens to make choices for themselves. And I think that day is today. I would love to see us move forward as a commission and be in charge of making policy for Sedgwick County. I want to trust our citizens, and I think the data is very, very compelling. I don't know that these health orders have actually changed our data. We don't really know that. It's hard to correlate. There's so much data that says that's probably not true. I think it's just time for us to say that we need to move forward as a community. Please respect each other. If you feel like you have higher risks, please wear a mask, stay distance from gatherings. Don't be around people who might infect you, but take personal responsibility and certainly get a vaccine. And I think that that's the right policy for us going forward. At some point, we're going to get there. I wish that this county commission would make a choice to go that direction today. Thank you, Chairman.
And Chairman, can I make a comment or two? I think Commissioner Howe, you made a good point about one of the options, and there's a plethora of them for you all today to make, to consider. Could be to revoke Dr. Minz's health order. Another alternative could be to amend it, and I've neglected to mention this as an option. You could amend it to be, instead of being effective through April 30th, you could amend it as being effective through April 30th or unless otherwise, or upon publication of Senate Bill 40 in the Kansas Register, if that would occur earlier. And so I think that's another option you could have if the will of the board was to keep the order in place up until the point that it's legislatively nullified. You could also have take action to make that change to Dr. Minz's order. With regard to the resolution and the chairman, I'd also defer to any thoughts he has. Again, it's just a recommendation. And I think the word generally is used in there repeatedly, I think in all 5 of those options. The intent behind that was, instead of having the laundry list of exceptions that we've had in an order, to just kind of say, to recognize there may be circumstances where strictly requiring everyone to wear a face mask or face covering may not be appropriate. And so I think in lieu of listing all of those out like we would in an order, we just use the word generally.
Okay, thank you. Commissioner Lopez?
Thank you. Did we hear if Governor Kelly is going to allow us to start vaccinating everybody at this point? We haven't heard back. Okay. I guess I understand that if we put in a health mandate now, we could be opening ourselves up for more lawsuits. But I guess I just don't think that that's, good policy to make those changes on an assumption that something could potentially happen. We know that masks help. And I know there are plenty of studies that you can find both ways. I mean, we can go anywhere on the internet and find an argument for anything. I know KU did a study that is for Kansas that shows that masks do slow the spread. This was really looking at when it was the height, and I know that is different now, and the scientific method plays out, so we continue to learn, and things have probably changed somewhat, but I mean, masks slow the spread, and we know that. And so I just don't think it's a good way to govern, to say potentially this could happen, so we should not do something knowing that masks do slow the spread. And so I understand that, people are frustrated and tired of this. I mean, we all are at this point, but I mean, as a community, we have had to make so many sacrifices to get here, and I think we are so incredibly close to a point where we don't, we might not need them. I mean, I think we are getting there, but I feel like we're kind of at that race of getting people vaccinated versus, just giving up right now. And so I don't think that we should get rid of the mask mandate just because there's a potential that we could be receiving lawsuits going forward. I mean, if that does happen, we can then take a look at that and decide from there what to do. But I just don't think it's a good idea saying because something could potentially happen, we should change something that's this large of a scale. So that's where I stand with this. Thank you.
Commissioner Howe?
Thank you, Chairman. Just wanted to answer the first question that Commissioner Lopez asked, and that is that Dr. Lee Norman, Secretary of KDHE, yesterday stated that the state maybe would move into Phase 5 in May. That was yesterday, he said that. And so I find it very troubling that, considering where we're at with our vaccine availability to our community, I do not want us to sit back and do nothing with Phase 5 until he says, okay, in May. That's way too long. We should be doing that this week, in my opinion. Thank you.
And could I add, I would agree. We need to go to Phase 5. If the state is going to say that we can no longer do these mandates unless we are opening ourselves up for that, then they need to go and change that we can vaccinate everybody. Because I know a lot of people who can't get vaccinated right now, and we're basically telling them, too bad, you can wait, but we are no longer going to do what we've been doing for everybody else, which is trying to slow the spread so you don't get sick. So if we can't keep masks, then I think we have to do everything possible to get with the state and get them to change that, because I don't think it's even remotely fair to the people who are unable to get vaccinated right now.
Okay. Well, I hope that each of you are making your own personal contacts at the highest levels you can to move to phase 5. I can tell you that I have been doing that yesterday and Monday, and not this morning yet. So I'm doing every contact I can to encourage moving to phase 5. So I hope that the rest of you are doing the same. Anyway, Commissioner Cruz.
Thank you, Chairman. Justin, can you help me understand how schools and businesses could be impacted with this if they require masks within their respective places?
Sure, and I'll do my best to answer that, Commissioner Cruz. I think I gave a similar disclaimer yesterday that I've focused less on how Senate Bill 40 applies to schools and other entities as opposed to the county, but I'll do my best to answer that. First, with regard to schools, there is some language in Senate Bill 40 that would, first off, it would clarify, I think this is an important point to make, it would clarify that local health officer orders that may be approved by the Board of County Commissioners would not really be able to apply within schools, colleges, and universities, and technical colleges. So, that one of the important things to know is that there's kind of, the legislature has made it to where there would be a hands-off approach in terms of local health officer orders applying within schools. It also appears to, recognize the constitutional powers that school boards have. And I believe it applied to colleges and universities too, but I know your question is about, I think, K through 12 schools, and that they could maintain and regulate these matters, but it gives a similar standard to them in terms of the strict scrutiny analysis. So I would imagine, and of course each of the schools would have to consult with their own legal counsel, but I think they would be in a similar position right now to where you are in terms of if they wanted to require staff and students to wear masks, they may well face lawsuits. And with all the same stuff we would have, it'd just be a smaller population instead of being 500,000 potential plaintiffs. It'd be all the employees, and the parents could file lawsuits probably on behalf of their kids and that kind of thing. And so I think they're in a similar position. Businesses, Senate Bill 40 would not impact businesses' ability to still require folks to wear masks within their business. They would maintain that ability, just like they do today, just like they always would. And of course, those businesses would have to, I don't know what practical effects there would be for each of those businesses, and they all have to probably weigh that if there's no longer a mask requirement in place as to how they would handle that. I know I've heard a number of different businesses have different approaches, but ended in businesses with very different approaches on this too. So.
Do you know of any lawsuits that were successful in showing how masks have harmed a business or harmed?
I'm not aware of any, Commissioner Cruz, in terms of any lawsuits sustaining that kind of claim. I'm not.
Okay, I have a lot more to say, but I'd like to hear from my other commissioners.
Okay. I don't see anybody else speaking, so.
I have one question.
Yeah, Commissioner Lopez.
I apologize, just one more question. What would happen if they didn't say we could go to phase 5 and we went to phase 5? What would be the consequence of us choosing to move to phase 5 without their consent?
I don't know the answer to that question. We tried to stay within the phases because there was indications earlier that if we moved ahead of the rest of the state, that they would reallocate vaccines to catch everybody else up to that phase level of whatever it is we were moving to. So I guess to read between the lines there, if we would move to phase 5, it could jeopardize phase 3 and 4 vaccinations, and it would be allocated to other counties so that they got caught up to that.
Would that change now? Because I know when that was stated before, the state did not have nearly the vaccines that we have now. So if they held vaccines back, even if they have them, is that something that they would do?
I don't know, Commissioner.
Okay, thank you.
Okay. Commissioner Cruz?
Thank you, Chairman. You know, never in my wildest dreams would I imagine that we would be having this conversation again about masks so close to the finish line. You know, in my opinion, Senate Bill 40 is a big scare tactic used to punish public health professionals. The most important part of the strict scrutiny issue here is that masks are the least restrictive measure we have. If we take masks away, what percentage of our population will be too scared or not want to visit businesses because there are others out there not following any sort of health protective measures? I don't really feel like we as a county and we as a Board of Health should fear these threats, but instead put our local community ahead of the Topeka political games. SB 40 requires the courts to hold hearings on challenges within 72 hours. The judge would have to make those findings within 7 days, or the challenger would win by default. Could our chief judge, not set a special docket that would review the filings for merit? Any filing found that had merit would be set for a hearing and the findings within 7 days. It's very unlikely that anyone in this community would prevail if a mask mandate is narrowly tailored. I would like for our attorneys to understand how we could word something to narrowly tailor our mask mandate. How do you prove damages from a mask mandate? Any damages from previous mask mandates could have been mitigated by applying for aid like the PPP and our CARES grant programs. On page 10 of this legislation, the court shall grant the request for reliefs unless the court finds such order is narrowly tailored to the purpose stated in the order and uses the least restrictive means to achieve such purpose. So it's important to note that this language implies a new advantage to the challenger. However, it merely is setting the standard in statute that has been applied in case law so far in other matters around the nation. Alabama, dismissed because plaintiffs filed to prove they'd been injured as a result of the mask mandate. Wisconsin, mask mandate upheld because proof was provided that emergency still exists and mandate prevents the spread. Florida, the right to be free from government intrusion does not automatically or completely shield an individual's contact from regulation. This is particularly true when one individual choices can result in drastic, costly, and sometimes deadly consequences to others. Across the country, mask mandates have been taken to court and found to be a narrowly tailored approach to protecting public health in this pandemic using the least restrictive means. So when we enacted a stay-at-home measure, that was pretty restrictive, but we're not asking to do that, and we hope we won't have to do that. Let's make a mask mandate that clearly complies with the standards of this new statute, not simply throw up our hands and say it's impossible when it is very clearly possible. We have heard from our legal department over and over this last year that our health orders must be narrowly tailored and use the least restrictive means. This language should not be new to any of us. This statute should help us craft a mask mandate that creates clear metrics based on science, such as number of people vaccinated within our community, which brings me to a question. Yesterday, we were asked how many people have been completely vaccinated in our community. Tim Kaufman, can you answer that question?
Not completely, Commissioner, again, because we don't have the data from the VA and from McConnell, but I believe that the number I gave yesterday was in the neighborhood of 30,000. I'd have to go back to my notes from yesterday.
Thank you. So how are we coordinating? I know that we have conversations with KDHE each week. How are we coordinating within our community all the partners who are administering vaccines to know the number of people in Sedgwick County who have been vaccinated?
Vaccine providers are required to report to KDHE that the vaccines that they've dispensed, if they're other than those two that I've mentioned. So on Wednesdays, KDHE provides a report back that says, here's the vaccines that have been reported for your county. So that's the number that we use to identify the number of people in the community that have been vaccinated.
So last week it was 25% is what you reported.
It was an estimate.
It was an estimated.
And that was estimate based on those additional two providers and the folks that we believe that we know have tested positive. That 25% included all of those people.
And then I asked Dr. Menz a question around what would he feel comfortable in regards to lifting all restrictions, and he said 80% of our population vaccinated. That was what he mentioned last week. So given the fact that we have open appointments currently, I am in agreement with my fellow commissioners that we should be opening it up to all phases, especially if we're lifting restrictions, because those who want the vaccine should have access to it, especially if there's no measures in place to mitigate the spread, especially when there is a variant that is happening to spread through our community and our nation. And so I get it that at the beginning of this pandemic, we knew less about COVID, so we had less data to create these health orders. But now I hear from Dr. Menz, I hear from our fellow physicians and public health officials that we feel like we really do need to maintain social distancing and masks, which is the least restrictive health order we have and have had within the last year. Thank you, Tim. I appreciate your... This statute shouldn't scare us into shying away from our duty to our community to prevent another shutdown, because we cannot afford that. I would implore us all to work together on a mask mandate that is narrowly tailored as much as possible to comply with this statute and show everyone that we value the health and safety of our community above Topeka political games. It's sad when we have statutes that are written to punish others. We as elected officials have the ability to impact a lot of people with the decisions that we make because we have access to make these decisions. We have to make the decisions to the best of our ability for the community at large. I feel like we should hear from Dr. Menz. We have heard from him this entire time. I would like to know what his thoughts are. I have not reached out to him. I have not heard from him. I would like to know, before we make these decisions, we should hear from him. The other thing, I get it that we don't have a meeting by the time this order does go into effect, but as commissioners, it's our duty this is our number one priority. What other priorities do we have if we don't have this as a priority here as the Board of Health? We get paid to do this very well, I might add. So I think it's important that we make sure we are paying attention to what's going on and clear our calendars for a meeting if we need to address this situation after we've heard from our public health official. I think it says in the statute that we need to hear from our public health official in regards to making decisions, and I'd like to hear from him before any decisions are made. Thank you.
Okay. Any other comments? Commissioner Lopez?
I just have just one quick question. Sure. Do we know how many physicians or scientists or anybody who would have a better understanding of public health and this virus that are in Topeka making these decisions, that are trying to tell us what we can and cannot do? Or, is there anybody that has been elected that's been pushing this in Topeka?
Just to make sure I understand the question, Commissioner Lopez, are you saying are there medically trained people in the Kansas legislature?
Yes.
I believe there are. The number, I really don't know how many there are.
I would like to hear from them if what their thoughts are on this, if that's possible.
I
Well,
think,
we would-
and I
we would
kind of
have
looked
to-
to Mike. I don't know if our lobbyists could reach out to them, but that's
Or
just
if
an
I could
idea.
get a list, I could reach out to them. I'm fine with that.
Commissioner Lopez, we'll get you a list of any of them.
Okay.
Medical doctors in the legislature.
Perfect, thank you.
Commissioner Dennis?
Thank you, Mr. Chairman. Well, first of all, I do plan on continuing to wear a mask no matter what happens as a result of today, mainly because I haven't been vaccinated. So that concerns me about a lot of people that haven't had an opportunity to be vaccinated. So I support, if we need to make a motion to open up all phases in Sedgwick County and find out what happens, I don't have a problem with supporting a motion that we open up all phases at the present time. I also believe that we need to listen to not only our health professionals, but also our attorneys who advise us on what the impact is going to be on forthcoming legislation that we're sure is going to happen. And our attorneys are telling us with no doubt that we're going to be inundated with a number of lawsuits that have to be adjudicated within 72 hours. That's going to clog up our courts. It's going to clog up our legal system. Because the bar is so low, the chance of winning is fairly slim. So I think we need to take some kind of an action. And I think we probably need to take some action today rather than kicking this can down the road. So I would support the resolution that has been drafted, but with some changes. I think that this resolution, so that everybody understands where we're at and where we're going, rather than waiting, that we need to make the resolution effective immediately. That the resolution needs some type of an end date on it, possibly something like 90 days. We can always renew it after that period if there's some need to. I agree that we need to let the public know that we want them to become vaccinated. I do intend to become vaccinated when I have an opportunity to do that. That people continue to wear a mask, and I've already stated I'll continue to wear a mask. These are some things that I think are easy to recommend. But as we move forward, I think that what we need to do is stop the order that Dr. Menz has put in place at this time. That gives a finality to anything that's going on, and then to adopt this resolution with a few changes. So that's where I stand right now. Thank you, Mr. Chairman.
Okay. Well, I'm not sure that the resolution needs an end date. I don't recall we have hardly any resolutions that we've done with an end date, but we can, I guess if that's important, we could put an end date in there. I still believe that we've got an order in place that today that we did not rescind before, that would be in effect until this Senate Bill 40 is in effect. So I'm a little bit, I mean, I can go along with the changes you're making, but I don't see the importance of it, in that it really is forced the hand, has been discussed by the Senate Bill 40 to do so. So that's just my comments, but I would go along with those changes and be ready to make a motion, and we'll see what happens. Commissioner Howell.
Thank you, Mr. Chairman. I've been sitting back listening to the comments of my colleagues, and I'd like to make a comment now that, first of all, I'd like to lend my respect and my appreciation to Topeka and our legislative colleagues. To characterize this as being a political game, I think, is very offensive. I have no doubt they took this extremely seriously, and I don't want to criticize them for making public policy. This is what they were elected to do as well, and I think they do a very good job. And I'd like to show them appreciation and respect for what they do. with respect to, we're so close to a finish line, I'd like to know what the finish line actually is. Because if we say 80% vaccinated, we're never going to get there. I don't know that that's the right metric. I actually asked the question to Dr. Minz when he was here at the last time he came and spoke to the county commission. I said, what happens if we open up this to all people and our appointments are largely unfilled? Would that not be a point we would want to move forward? And he said, I think I agree with you. I think is what he said. I don't know exactly how he said it, but we seem to have agreement over that idea. So 80%, he also calculated in there the immunity from viral infection, which was a kind of a change. I hadn't heard him say that before, but he did recognize viral infection and people with antibodies as a natural consequence of them having COVID-19. He did calculate that into his calculation. He also stated that people are largely protected from needing ICU care and possible death from COVID-19 even after the first vaccination. It doesn't require 2 shots to get to that great number. Actually, the first shot does a tremendous job of protecting people from needing that type of care and having that type of mortality from COVID-19. And if I remember correctly, just the other day, I think we were briefed just yesterday, I believe, on vaccines. Yesterday we said we had 106, I had to calculate it to get there, but we had 106,000 people in Sedgwick County that have at least one vaccine. That's from Sedgwick County, and yet in the community partners that also providing vaccine, there's 31 places to get vaccines now in Sedgwick County besides Sedgwick County. There's a lot of others that are getting vaccinated. That number is at least 140,000 people in Sedgwick County have received one vaccine. And if you subtract out the population that can't get the vaccine because they're too young, that's about another 100,000 people. So the reality is, and by the way, the 140,000 doesn't count those that actually have immunity from viral infection. So you could add easily another 50,000 to that, maybe 100,000 to that. The number we could calculate that gets us to why is our dashboard so impressive? Why are the numbers so low? I think it becomes evident that this community has more immunity from infection and from vaccine than we've given it credit. I'm ready to move forward. I don't think this resolution is necessary. I know that people say it's just a bunch of recommendations. It doesn't do anything, but I think it sends perhaps the wrong message to the community that we're asking businesses to do this, we're asking people to do this, when it may not even make sense in some cases. In terms of the term narrowly focused or narrowly tailored and least restrictive, again, I think if you really wanted to write language that had those ideas built in, you would say socially distance or wear a mask if you've not had the vaccine or if you have no antibodies or no natural immunity to COVID-19. That would be narrowly tailored. So just this idea that we're going to broadly provide strong recommendations to a community that doesn't have that risk right now is not narrowly tailored. So again, I would be glad to make a motion to rescind this order. I don't know if there's anybody else who wants to make a motion before I do that, but if we're at that point, I'll be glad to do that. Thank you.
Okay. Commissioner Cruz?
So, as of now, there's no action to take unless we make a motion.
That's correct, Commissioner Cruz. There's no required action of the board. There's no staff recommendation as to a particular action. I believe the agenda said to take any action deemed necessary by the board. So I think it's really at the will of the board.
Okay. So it sounds like we have a couple commissioners that want to make motions. Is that what I heard, Chairman?
Okay. Well, based on everything that we've been discussing, I think it's responsible that we're transparent in supporting public health, which we are. The Board of Health has been said 1 million times in the last year. So, and the Board of Health making recommendations to promote getting vaccinations regardless of what the percentage is or not, and to allow businesses to have their own rules with their customers and about spacing and face masks, and so they can make their own decision about that. Has been quoted, they can have their own personal responsibility about such. We don't have in there, like has been said before, Commissioner Howe, you said if you see, talking about respect, I agree. If you see somebody with a mask, respect them and avoid them, or put on a mask yourself. We don't have that in there, but we don't have something about respect and all that. But I'll make a motion that this resolution be adopted with a 90-day departure and with a 90-day end and effective immediately.
I'll second that.
Okay, there's a motion and a second. Okay, Commissioner Cruz.
Thank you, Chairman. I would like to make a substitute motion that we defer this action until Friday to confer with our local health officer, Dr. Antonius, others who have been advising us this whole time, so we can at least give them the opportunity to advise what they feel is best going forward. So I have a motion to defer to Friday.
And I'll second that.
Okay. Commissioner Howe.
So again, I think then whether we like this or not, whether our health experts like this or not, the reality is our health order is going to go away as it's currently in place. Health Order 2021-4 is going to be nullified regardless. We can establish another health order if we want to do that. But the health order that's in place right now is going to be nullified regardless. And so we can talk to people. It doesn't really change the outcome on that particular health order. I would say, once again, I've said this before, we are the Board of Health. And you're right, we are not doctors, we're not nurses. None of us are qualified to be medical professionals. But we do have the input from many folks that are experts, and they talk to us and they provide us plenty of data. And Dr. Menz has done a good job of providing us information regarding the coronavirus in Sedgwick County. And we have lots of folks who have guided us and helped us understand the decisions we need to make. You know, I look at Congress in Washington, D.C. There are 535 members of Congress. They're not any one industry. They're all kinds of industries. The legislature's Kansas legislature is 165 people with vastly different backgrounds. And they make public policy on all things in Kansas. And they do that because they have people come in and provide expertise and information as they make those decisions. And this Board of Health is no different. So once again, I think it's disingenuous for us to criticize Topeka or the legislature for making policy when they've had access to all the right people to give them information as they go along the way. I don't see there's any need for us to delay till Friday, because again, I think that by Friday this may actually be over with, because governor might sign this today or tomorrow, in which case on Friday it would become effective. So I don't see any reason for us to delay. I don't feel comfortable making a substitute motion, but I would like to vote no, so that I can make a substitute motion to the previous motion. And I would like to make a motion that we rescind this order, but I will hold off on that for just a moment and let this one be voted upon first of all. Thank you.
Okay. There's been a substitute motion and a second to defer until Friday. Commissioner Lopez.
So while I agree having people with a diverse background is a really good idea, if I had a heart attack or if I came down with COVID, I wouldn't go to a diverse group. I would go to a doctor. And I think it's really important that we hear from them. If we say masks are now mandated or just required and not mandated, if that happens on Friday, okay, then if that's the will of the board. But I think it's really important that we have testimonies, that we have physicians and people who really understand this tell the public still how important this is to wear masks and how this virus is not gone. Because if we just say we recommend them now, one thing that we have heard repeatedly on these hospital calls, I've had physicians reach out, is just what message that sends to the community saying we don't have to wear masks anymore. It makes it sound like this is gone, and it is not gone. Our physicians, our medical community, they are nervous about this, and they're the ones who have had to bear this brunt this entire time. I think not allowing them to speak and not allowing them to give that input before we vote on this would be extremely disrespectful to a group of people who have gone above and beyond anything we could have ever asked for over this past year. So I would like to wait until Friday. Regardless if that doesn't change the outcome of the vote, I think it's extremely important that we hear from them before we have this vote. Thank you.
Okay, there, Commissioner Howell?
Thank you, Chairman. I just want to be clear, I don't want to be mischaracterized or misquoted, so I was just saying, I wear my mask largely because it's the order of Sedgwick County. I personally believe masks also help. I have lots of people I know that are in my circle of friends, and lots of people in my circle of friends would disagree with me that masks are beneficial or masks help. Nevertheless, I'd make a choice to wear a mask, especially to comfort those around me that are very concerned about COVID. I want to make sure I respect them. But I make a choice to wear a mask. I believe it does help, and so let's be clear. I'm not anti-mask. We also should recognize, no matter what we do with this health order, I've said it before, but we're not controlling people's behavior. There's lots of people right now that are not wearing masks, and no matter what we do with this health order, people are going to do what they're going to do. In fact, let's be clear: there are no individual penalties being enforced right now for people whether they wear a mask or not in Sedgwick County. So. And then let me finish with a final comment. I also love our healthcare professionals. I know they do an incredible job. They are heroes in my mind. And we could have not got through this pandemic without their incredible skill and their incredible sacrifice to help so many people that have had to go through their hospitals. I want to just say I appreciate them and love what they do, and I want them to know I don't want to do anything that would cause them to have a greater burden at all. And I think as we are looking at the data, let's be clear, the hospitals right now have given us a green status for over a month. That means something. So once again, if not today, if we don't view this as a finish line, we can continue to monitor things like the hospital data, and we can always I hate to use the word circle back, that's not a good phrase these days. We could circle back, I guess, and we could come back and visit this idea of health order once again. We're not limited today that we can't have a health order going forward. If we have discontinuity in the health order going forward, we're going to circle back and do it again if we need to. Hospital data gets bad, we're going to be right back in this conversation once again. So again, I don't know that this delay makes any difference whatsoever. Thank you.
All right, there's been a motion and a second to defer. I don't see other comments. Madam Clerk, please call the roll.
Commissioner Lopez?
Aye.
Commissioner Dennis?
No.
Commissioner Howell?
No.
Commissioner Cruz?
Aye.
Chairman Meitzner?
No. Okay, we go back to the first motion, which was to adopt a resolution as presented with the two adjustments on there. There's been a motion and a second. Commissioner Howell.
Mr. Chairman, I've said plenty. I think it's just time for us to go ahead and find out where we are on this idea. I'd like to make a motion. We would rescind Emergency Public Health Order number 2021-4 as amended by the Board of County Commissioners.
Okay, there's a motion.
Is that a substitute motion then? Because we've already got a motion.
Substitute motion, I apologize.
Good motion.
Thank you.
Okay. So you're asking to rescind it without the resolution, just to rescind?
Yes, sir, that's my substitute motion. Okay. I'd like to deal with this part of it first, and if we want to continue with another motion to... Is there
a second? Commissioner Dennis?
Before I make a decision on the second, since this is a substitute motion, it would eliminate the original motion, and I think that it's still a valid motion. So I've got a little bit of a problem right now on which direction we're going to go. I'd rather work the original motion, and then we could come back and worry about the health order.
Commissioner Howell?
Yeah. Let me just point out, thank you for the point there. Let me point out that the resolution actually references the idea that this health order is going to continue to be in effect until publication in the Kansas Register of Senate Bill 40. Let me just say this. If my motion was to pass, there's nothing that would prevent another motion to deal with a recommendation or a resolution that would establish this type of language. This doesn't prohibit that from happening as a secondary motion after the motion to rescind would be voted upon.
Okay, I'll just comment that I understand your substitute motion is just to rescind the health order, but based on every comment that you've been saying so far, that you don't feel that a resolution and instructing people is worth anything. And so I know I'm not confident that the resolution would have a chance to pass if we take it up afterwards. So, Commissioner Dennis.
Yes, and once again, I would rather go back to the original motion, and then we can look at the possibility of, actually, I've got another motion to open up all phases.
Okay.
So I think there's several steps we need to go through, but I think we need to work the original motion first, and then we can work through the other phases. Thank you.
Okay, I can, Commissioner Cruz, and a reminder, but there's still not a second on the substitute motion. Commissioner Cruz?
Okay, so that was my question. As a point of procedure, are we getting rid of the substitute because lack of a second?
If there's a second, I'll call for, is there a second for the substitute motion for Mr. Howell? I do not see a second, so Commissioner Howell's substitute motion dies for lack of a second.
Okay.
I'm sorry, go ahead.
Go ahead.
Oh, I was just going to say that, and Commissioner Cruz, I didn't want to interrupt you. I think there may be a will on the part of the public to have a little clarity as to what the underlying motion is right now. There's been a lot of discussion, and am I getting that right? Just so that, and so I think.
The motion in the second is the resolution as presented with the inclusion of two items. One is that it's 90 days before it, to extend it for 90 days, and the second that it becomes official today instead of at the end of the, instead of when Senate Bill 40 comes into play.
Okay, thank you.
Okay, I don't know. Commissioner Cruz?
So I have a substitute motion I'd like to make. I move that the Board of County Commissioners approve a resolution to amend Emergency Public Health Order Number 21-04 as it had previously been amended by the Board of County Commissioners on March 16th, and to approve such amended order with the following change. 1. Section 3 of the order on social distancing provisions would be deleted. The motion would leave in place Section 2 of the order that requires the wearing of face masks and other face coverings. This continuation of Section 2 of the order would be narrowly tailored to apply until a percentage to be determined by our local health officer of Sedgwick County residents would have been fully vaccinated for COVID-19.
Sorry, go right ahead. I was going to.
I'll second that.
And Commissioners, I will point out, Kate's going to pass out a resolution draft that looks very similar to what Commissioner Cruz just read, but is not quite the same. The slight distinction would be, and Commissioner Cruz, tell me if I get this wrong, would be that it just has the resolution draft just shows a percentage blank, and Commissioner Cruz's motion made the point that it would be a percentage to be determined by the Sedgwick County local health officer. Is that correct? Okay.
That's correct.
And then also a copy of the current Sedgwick County Emergency Public Health Order number 2021-4, as the board amended on March 16th, is also being passed out in case you need to reference that.
Okay. Any questions, clarifications on this? The percentage is not filled in, so it's a blank percentage.
It would be determined by our local health officer. That is the amendment to what is being presented to you. So Section 2 would say, of emergency public health order would cease to be effective once a percentage of Sedgwick County population would be fully vaccinated with the COVID-19 vaccine, to be determined by our local health officer.
And we've had a number of comments that we never know the exact number that's being vaccinated, but I guess I see what you're saying. But there's no defined percentage that I know of yet. Commissioner Howell?
Thank you, Mr. Chairman. So curiously, county population, does that include children under age 16? When you calculate the percentage, does that count people who are 16 or under age 16?
Well, a couple comments on vaccination rates. And to answer your question, Commissioner Howell, the number we have used from the onset of this was a percentage of population that were eligible for vaccine.
Okay. But it doesn't actually say that in this comment here. This doesn't say that. It says percent of the Sedgwick County population. So that would be maybe a minor amendment that would be needed for this to be an accurate.
So we could say, if Commissioner Howell, if you don't mind, I jump in. Okay, sorry for the interruption. So Justin, help me here. So if we're going to determine emergency public health order would cease to be effective once percentage of the Sedgwick County population who are eligible for the vaccine would be fully vaccinated with a COVID-19 vaccine percentage determined by local health officer.
Commissioner Cruz, I think that would be an effective way to amend the motion. I was going to ask, and I may have not caught it. Was there a second to the motion that's been made? Yes. Okay, just double checking. Sorry, but yeah, I think that would capture the intent. Obviously, Commissioner Howell can opine further, but I think that would be good language.
May I continue?
Yes, go ahead.
Okay, so just to be clear, on our dashboard today, we say that there's 30,890 people who are fully vaccinated in Sedgwick County. Of course, we don't know what's happening with our partners. We don't have any way to know that for sure. But if you subtract out the 100,000 children, again, that may be a high number. Maybe it should be lower. Maybe it's 80,000. Regardless, the calculation right now would come out to about 7.75%. And I think Dr. Menz the other day said 80%. We are, again, I have a couple of problems here. Number one, I think we're essentially giving over the idea of a finish line, again, to an unelected, very great man. Dr. Menz is a good man, but he's an unelected appointed official. We're essentially giving over the idea that he will determine the finish line, not the county commissioners. The fact that this is a blank is very bothersome. We should put a number in there. Pick a number. But to leave this blank and let that be determined in the future, that can maybe moving the goalpost, we hear that phrase once in a while, changing the numbers as we go forward. He would start out and he would say 50%, then he might change it to 60%. How do we know? I don't think this is the right way to do this. And I think for many reasons, this is not a good strategy. And I would implore us to vote against it. Thank you.
Commissioner Cruz? I'm sorry, I meant Commissioner Lopez.
Okay.
I'm sorry.
If we need a percentage number, then I would say if we waited until Friday until we could hear from people before we just make this decision, we could have that to vote on. But if none of us can sit here and say it has to be a certain percent and have that knowledge to make the right decision. So if we wait until Friday to vote for this, we can have a percentage number, and then you can vote on that. But I think we have to hear from people. We can't just vote on this today without any input from them.
Commissioner Cruz?
Thank you, Chairman. That's exactly my point, which is why I made the motion to defer, which failed. And so now I'm put in a place where I want to make sure that we acknowledge to this community that there are some who support health measures and who support what our physicians in our hospitals are telling us. The stories that come out of those ICUs, the stories that come from our family members who have lost a loved one. Over 500 folks in our community are the seat around the dinner table is empty. And so it's important, I think, that we don't just give up this fight. We don't give up a fight because there is a potential for something to happen. It is our duty to do this, and that is why the motion is made today. Given the option to have an opportunity to speak with our local health officer who is not here, if we could get him on the phone, perhaps he could help us with this decision. But I don't know that that's possible, and so that's why that's why this motion was made in its current form.
Okay. I'll just add that everybody thinks that it's been said that this is what may happen as far as legal lawsuits. I've had 3 conversations directly knowing that there are people standing in line ready to file against school districts, us, and any, in another major county that I talked to, they were well aware from their legal department that there is, that they are preparing for huge defense of lawsuits. And that was that person's words directly. So the potential threat of lawsuits is, in my opinion, verified by 3 conversations with people in charge. It's very real. So, Commissioner Howell?
Well, thank you, Chairman. Just want to ask a question so I understand the intent here. But if we open up Phase 5, which again, I love the idea of the motion for us to get into Phase 5, I will glad to support that or second that, and I look forward to voting for that. Let's assume right now we open up Phase 5 and we are right back where we are today with majority of our appointments not being filled. And we're still only around 7 to 10, 15% of our population has been fully vaccinated. What do we do then? We're not, again, Dr. Menz actually said 80%. That is a huge number compared to where we are today. How long is this mask order going to be in effect if that happens? That's a question.
And Commissioner Howell, was that directed to
No,
me?
actually, I'd
or-
like to ask the maker of the motion. I'd like to ask that question to the maker of the motion.
Until the percentage determined by our local health officer of vaccinated individuals who have the ability to get the vaccine or who are eligible to get the vaccine is achieved.
Okay. Once again, I think that this is a threshold that we're not going to get there. And I think that to put an order in place that actually proposes something that's I would say extremely unlikely is not good public policy. Thank you.
And Chairman, I may also supplement, I know your question wasn't directed to me, Commissioner Howell, but the effect of the resolution draft that's been handed out, if it were to be approved, as I understand it, it wouldn't extend the term beyond April 30th, which is the current end date on Dr. Menz's order. Certainly could be shorter than that if enough people got vaccinated, depending on whatever the percentage established could be. I was going to pass along a comment. As I understand it, I believe Madam Deputy Clerk wanted to get some clarification on what the existing motion is that's being considered. I think Commissioner Cruz, you're the motion maker.
Yep. Was she given a copy of it?
I have a copy of the draft that was mentioned after you started your motion.
Okay, so the motion is, I move that the Board of County Commissioners approve a resolution to amend Emergency Public Health Order Number 21-04 as it had previously been amended by the Board of County Commissioners on March 16th, and to approve such amended order with the following change. 1, Section 3 of the order on social distancing provisions would be deleted. This motion would leave in place Section 2 of the order that requires the wearing of face masks and other face coverings. This continuation of Section 2 of the order would be narrowly tailored to apply to a certain percentage of Sedgwick County residents available for the vaccine and have been fully vaccinated for COVID-19 as to be determined, the percentage to be determined by our local health officer.
And I think it could be beneficial for the commissioner who made the second to confirm that that's what their understanding is as well, just for clarity. Okay.
Okay, there's a substitute motion and a second. Commissioner Dennis?
Thank you, Mr. Chairman. Once again, I've already voted that I would not support or stated that I would not support a substitute motion against this base motion that we've got working right now. I think it is important to work through this process step by step. And after we work through this part of it, I don't have any problem with going back and taking a look at 2021-4, either to terminate it or take other action. But right now, I won't support the substitute motion. I want to work the base motion. Thank you.
Okay. Any other comments? I don't see any. Madam Clerk, please call the roll.
Commissioner Lopez?
What are we voting on? We've done some.
Substitute motion.
Voting on the substitute motion on mask.
Aye.
Commissioner Dennis?
No.
Commissioner Howell?
No.
Commissioner Cruz?
Aye.
Chairman Meitzner?
No. Motion fails 3-2. Goes back to the original motion. Any other comments about the original motion? Being none, Madam Clerk, please call the roll.
Commissioner Lopez?
I struggle with this one because if
Right.
we are going to completely give this up, then we need to be recommending. But I am completely not in favor of giving this up. But since that's not the will of the board, I will say aye and I will say yes.
Commissioner Dennis?
Aye.
Commissioner Howell?
No.
Commissioner Cruz?
No.
Chairman Meitzner?
Aye. Okay, the motion fails 3-2. So we have nothing. Is there any other business on this item? I don't. Commissioner Dennis?
Mr. Chairman, I make a motion that Sedgwick County moves into Phase 5.
I have a question. We don't have the legal authority to move into Phase 5. We could make a motion to request to go into Phase 5, but I don't think we have.
Well, Chairman,
Standing.
I'll
I
do
don't
my
think we-
best to, do you want me to answer that?
Well, yeah, I don't think we have standing unless we're a county that can do it when the others can't.
And Tom can correct me if I'm wrong on any of this. And if I'm understanding the motion, the will would be to move into Phase 5 in terms of how we're administering the vaccines. I think
Right.
county staff is in control of how we administer those vaccines. What consequences may stem from that at the state level, I think Tom or Tim may have already spoken to that. And I believe legally the state is the primary dispenser of vaccines within the state of Kansas, so I think, I'm not sure what the impact of all of that would be, but I think we could move into Phase 5. I just, not sure what will happen in the future on that.
All right, okay, thanks for clarifying. Commissioner Dennis?
Well, thank you, Do I need to clarify my order then and say that, administratively, that Sedgwick County starts administering based on Phase 5?
That was how I understood your motion to be, Commissioner Dennis. I don't think that makes a difference from what I just said a minute ago in terms of how I think it could play out and all that.
Very good, thank you.
Okay, Commissioner Howell?
Thank you, Mr. Chairman. Just I want to remind the board that Senate Bill 295, I did testify in favor of that, which would actually, again, hasn't passed. It's still in committee. It's in the Senate Public Health and Welfare Committee. I was the only person that testified on that bill, but I testified as a proponent. The bill was drafted by Senator Hildebrand, and the legislature is standing by, waiting to see what happens. It's interesting, I can't say for sure what caused it, but the very same day I testified in favor of allowing Sedgwick County to have some control over the vaccine distribution strategy. That very same day, the governor announced that we're going to move into phases 3 and 4 immediately. That afternoon, she made that declaration. There had been some comments prior to that the state would essentially punish counties for not following their edict of the state. Their strategy had to be followed directly, and if we didn't follow that, they would essentially punish the county by not giving us vaccine. One of the previous commissioners did mention earlier that there seems to be an abundance of vaccine flowing into the state of Kansas, and the goal, of course, is to get people vaccinated as quickly as possible. I would be extremely troubled if the state decided to punish Sedgwick County. In light of Senate Bill 40, I think that Commissioner Lopez was exactly right. Senate Bill 40 is going to make it so our local health order is moving in a direction that there are people out there that would love to get the vaccine that haven't been able to get it, and they feel somewhat vulnerable and higher risk. Imagine, if you will, this crowd that goes to bars at night. We've been talking about them over the last several months. This population is probably largely unvaccinated because they haven't had access to the vaccine. I think it is not ethical or moral to put these people in that position without offering them opportunities to mitigate their own risks. So I think we need to move forward, and I would, again, I don't know what I would say to the state, but I would be shocked if they would take that strategy and punish Sedgwick County by not giving us vaccine. And I suppose if they were to make that clear and threaten us with that, we can come back as a board, and we might change our strategy. But right now, I think with what we understand, by the way, they talked about on the news last night, 100,000 doses of J&J coming to Sedgwick County next week, they said. I don't know if that's been validated by anybody. I see our manager's kind of saying no back there. But I guess my point is this. There is lots of vaccine flowing into Sedgwick County. We have vaccine on the shelf ready to go. We have open appointments. There's no reason not to move into phase 5. And I think that, again, in light of Senate Bill 40, we really need to make this decision today. So I think that's a great motion. There's no reason to change the motion. I think it's perfectly worded. And if the state chooses to punish us, yesterday when I was interviewed on this, I used the word reckless and immoral. I think that's what this is. They need to let us move forward. Thank you.
Commissioner Lopez.
I just have a question about that. Who makes that decision if they stop giving us vaccines because we moved to phase 5?
I'll maybe ask Tim to go to the podium and we can tag team this, but after the discussion yesterday, I think our strategy was to ask Dr. Nielsen. She is the highest point of contact that I have, for example, in the state. Dr. Menz, of course, can go to Dr. Norman, and then Phil with the state also. There's a group of people there that make the decision on allocations within the state. We were going to request, based on our open appointments, that we would be allowed to move to phase 5. Now, that has not happened yet, but that's the group that we go to.
And it just, so I'm clear on this, in the past, when we were still in phase 2 and smaller counties were already moving past that, do we know what happened with them? I mean, I know that we started receiving more vaccines at the state, and then we started receiving a percentage more equitable for our community size, but do we know what came of the other counties?
Anecdotally, we understand that there were some counties that had their allocations suspended so to allow the rest of the state to catch up with them.
I would concur with that, and we'd specifically heard about Riley County in that matter, to the point where Riley County, I think, complained about it, and I'm not sure how that was ever resolved, but that is true anecdotally. We had heard some counties were, I guess suspended is the right word.
How many vaccines do we have on hand? How far can we go with what we have, just out of curiosity?
I haven't looked at the numbers today, but we're in a 2-shot system, so whatever vaccines we have on hand, we need to make sure that we have enough to, in 3 weeks, we can come back and vaccinate again. But we always, our goal in the health department was to always have at least 10 days of supply, and I don't have any reason to believe that's different today.
I think that's still accurate. We have at least 10 days worth of supply.
And the only card out there yet is, as Commissioner Howell referenced, we expect and have been told anecdotally to expect more J&J by the end of the month. We have not been given confirmation on exact dosages yet from the state of Kansas, but we expect to receive that either this week or next week. But we anticipate getting and hoping to get a large supply of Johnson & Johnson. That seems to be so sought after in the county, just based on the 3,800 doses that we had gotten and how fast those appointments filled on Thursday. It truly is, I think, a game changer for jurisdictions that can have access to it.
And what would your recommendations be on this?
I'm sorry?
Your recommendations with this motion?
We work for the will of the board. I think that when it comes to dealings with the state of Kansas, whether we're talking testing or PPEs or now vaccines, that we should communicate our wants to them, just as the commission did a couple of weeks ago with comorbid people and sick people. The commission wrote a letter actually and asked the state. We didn't get immediate results, but as Commissioner Howell said, we did get results from that ultimately. I don't know what pushed that, but I always advocate for communication before other tactics, but we work for the Board of Commissions. Whatever the board decides today, staff will enact.
Okay, thank you.
Okay, Commissioner Dennis.
Thank you, Mr. Chairman. We saw what communication got us last time. Didn't get a response. So I don't know that communication is doing any good. And I would, personally, if I was sitting in the governor's seat and a county said, I've got hundreds of openings every day, and we have the capacity to put vaccine in the arms of our citizens in the state of Kansas, I would not want to be the person to say, well, I'm not going to allow you to put vaccine in the arms of the citizens in the state of Kansas. Well, I think that it is appropriate when we have openings, especially the numbers. You can go on the website right now and you're going to find hundreds of openings. And we want vaccine in the arms of the citizens in the state of Kansas, and that's what my motion is intended to do. Thank you, Mr. Chairman.
Okay. Well, okay, I've had a lot of dialogue. Personally, I would prefer that we formally ask to move and get the authority, but I hear what you're saying. I'm very cautious that all the positive steps we're trying to make, I don't want to create any sense of lack of whatever between us and KDHE and the process we have going on now. But I fully understand everybody's thoughts on this. I would prefer to formally request and even an answer within 24 hours, but that's not the motion. So, Commissioner Cruz.
So I would like to make a motion to defer this until Friday so that we can ask the state of Kansas what they're going to do as far as opening it to phase 5. I think if we can kill two birds with one stone, we can determine what's best for our community and ask the question and have a meeting to regroup on Friday to see what that determination will be on Friday. So my motion is to defer moving to phase 5, the vote on that until Friday.
I'll second that.
Okay. Commissioner Lopez?
Yeah, I was actually going to go with that too, so I'm glad you said that. But, we are put in such a terrible position here because we are told that, one, we don't have the same ability to keep masks, right? Or else it's going to, and then we can't even vaccinate everybody. And I think that's so incredibly unfair to these people because there's so many people who want vaccinated right now and they don't qualify. And I think this is just, it's really frustrating that the state is putting us in this position. And I think we need to, when we ask them if we can go to phase 5, if we are very explicit about that point, because if they're not able to get vaccinated yet, and then we're also going to be, less strict when it comes to masks, I think I completely agree with what Commissioner Howell was saying about it, so thank you.
Okay. Commissioner Dennis?
Thank you, Mr. Chairman. I agree with Commissioner Lopez that they're putting us in kind of a bind right now, and that's why I think we need to move into phase 5. But if the motion maker for the deferral would amend it and say that if we receive no response by Friday, that we will move into phase 5, I have no problem with asking the governor and letting her respond. But last time they didn't respond at all. So if we tell them we're going to move into phase 5 Friday, unless you tell us we can't, I would support the substitute motion.
I think she indicated we would delay the vote until Friday. So I think that is kind of her clarify. So the motion is to defer till the vote on moving to phase 5 until Friday.
Yeah, correct, because if they say yes, then there's not really a need to have a vote. But if they say no, at that time we can make a determination, knowing that we have reached out and had the conversation with the state of Kansas to at least give them the opportunity and have a discussion around what it means for us if we were to go into phase 5 and jeopardize vaccines coming into our community. So in order to be good partners, let's have a conversation, and then if they tell us no or they don't respond, then we can have a conversation, because this order, HB 40, will go into effect on the 28th. And so that's essentially, we're trying to get something accomplished before then. So that's
okay.
Would that be agreeable?
Can I respond?
Sure, absolutely.
Thank you. I'm agreeable to that, Commissioner. And I just want to make sure that we have some kind of And waiting until Friday also gives us an opportunity to get the word out that we're going to open it up to phase 5 and so forth. But I want some kind of assurance that the governor is going to make a decision saying absolutely we can't move into phase 5, or if they were going to let us do what we need to do in order to get vaccine in the arms of the individuals. I think the unacceptable answer is to hear nothing back from the governor. So that's why I think I'm fine with waiting until Friday.
And you mean, by saying the governor, you also mean Dr. Norman as well, KDHE. Okay, there's been a substitute motion as explained and a second by Commissioner Lopez. So I don't see any other comments. Madam Clerk, please call the roll.
Commissioner Lopez? Aye. Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Motion carries. So we will calendar up and figure out the best time for a Friday. Could be a very quick meeting. Okay.
Thank you, Chairman.
Commissioner Howell.
Thank you, Mr. Chairman. So as promised, I'd like to come back and visit the health order we discussed at length today. I would like to go ahead and make a motion. We would rescind Public Health Order number 2021-4 as amended by the Board of County Commissioners.
I will second that.
Okay, didn't you make that motion earlier?
I did, but I didn't get a second, and we were waiting to do the discussion on the resolution first, and so I thought I would come back and visit this again now. Thank you.
Okay. Okay, there's a motion and a second. Madam Clerk, any other comments? I don't see any. Madam Clerk, please call the roll.
Commissioner Lopez?
No.
Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
No.
Chairman Meitzner?
Aye. Motion carries. Okay, anything else? Nothing on this. Madam Clerk, next items, please.
Consent agenda.
Tom,
Sorry,
consent
Commissioners.
agenda.
Catching up. Recommend, Tom Stoles, County Manager's Office, recommend approval of consent items R through AF this morning, or this afternoon.
Any questions about consent items R through AF?
And Chairman, let me go back and correct that. We do want to, we ask for approval of all of those except item AA, which I think Mr. Weber wants to talk about.
Okay, I'll make a motion to approve consent items R through AF with the exception of AA. Is there a second? Okay, motion might die for lack of a second.
Second.
Okay, there is a second. Madam Clerk, please call the roll.
Commissioner Lopez? Aye. Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye. Okay, item AA. Jim, welcome to the meeting.
Morning, Jim Weber, Director of Public Works, and I'm here to report on a very rare mistake that I've made and ask you to help me fix it. All right. So AA is a request for a salary exception. We're trying to hire a surveyor. It had gone through the administrative process and included 5 days of vacation at start of employment. That all went through, but when I went to create the agenda item, I left off accidentally the 5 days of vacation. So we just ask that the approval motion be changed from approve the request to hire a surveyor above grade minimum to approve the request to hire a surveyor above grade minimum with 5 days of vacation available at start of employment.
So moved.
Okay. There's a motion and a second to approve item AA as presented by Jim. Any other comments? Being none, Madam Clerk, please call the roll.
Commissioner Lopez? Aye. Commissioner Dennis?
Aye.
Commissioner Howell?
Aye.
Commissioner Cruz? Aye. Chairman Meitzner?
Aye.
Thank you.
Next item, please.
Legislative issues.
Well, we've been talking about legislative issues for the last 2 hours, so.
Good morning,
Chairman.
Chairman.
Else?
Commissioners, Akeem Ashford, Communications Director. It's just going to give you guys a rundown of other bills that we have. I can report some good news to you this morning. So during our commission meeting, the Committee on Local Government did pass Senate Bills 52 and 53. So if you'll remember, that's the nuisance abatement bill, and then this is our charter commission bill. So these are very good wins for us today. And so now we'll move to the House floor for a vote. In addition to that, there were a number of healthcare bills that I think Commissioner Cruz and Commissioner Lopez talked to our contract lobbyists, Walking Strategy, Public Strategies about, and so I just want to provide you all an update on those. The first one will be, let's see, the House Bill 2281. This is our 988 bill. This bill will establish and implement 988 as the suicide prevention and mental health crisis hotline here in Kansas. The status update is that this one is still in committee. We hope that it will be worked this week. I haven't had any more discussion on that, but we'll continue to work with Jason and his team to get more information. In addition to that one, we've got House Bill 2208. This is our Certified Community Behavioral Health Clinic bill. This bill actually is on general orders for today, so we expect a vote at some point as well. I hadn't gotten one from Jason at this time, but we'll check back with him and give you all the vote on that later today. If passed, this bill will go into conference committee and then on to the governor's desk for approval. Moving on, we've got the KEMA bill that we've talked extensively about. That's Senate Bill 40, as well as Senate Bill 149. Senate Bill 149, this is again the bill that provides reimbursement of property taxes from county government. This bill is still sitting in committee at this time. Senate Bill 181, we had a lot of traction on this bill yesterday with input from Chris and his staff. This bill, as you all remember, will create the Elevator Safety Act to require inspections of elevators and licensure for elevator installation and repair. This bill is actually still sitting in committee on federal and state affairs. And in an update from Jason yesterday, the bill did pass out of committee, which is the Senate's Fed and State Committee. There is an amendment that we're asking on that bill that Jason did give an update. And basically, it would give Sedgwick County, it would remove us basically and allow us to make those inspections on our own. So we would have to use the state's fire marshal. So that would be an exemption for Sedgwick County. Let's see, moving on to driver's license reform. So on the next page there, there's a number of bills, 264, and I can answer any questions that you guys have on these, but I do have a description there for you, as well as the status of those bills. But moving down to Senate Bill 127, this is the suspended driver's license reform. I know this is a bill that Commissioner Howell talked about extensively. Commissioner, this one still sits in committee, and we're just waiting to kind of see what happens next with this bill. Senate Bill 13, the last one on your list there. This is the property tax reform bill, removes the tax lid and puts in place a revenue neutral rate. Again, this bill was presented to the governor Tuesday, March 16th. So we're just waiting until that day, whether she signs it or it goes into law. With that, unless Mike has any questions or any input, I'll stand for any questions that you may have.
Commissioner Dennis?
Thank you, Mr. Chairman. First of all, thanks for the update on Senate Bills 52 and 53. That's great news that they moved out of the committee and to the entire House. I just have one concern about Senate Bill 53. This is a good bill. It clarifies a lot of the doubt around what we can and cannot do in Sedgwick County. So I guess I've got a couple questions I want to make sure that is clear, because I got phone calls last night from legislators in Topeka because they didn't understand what Senate Bill 53 did. And because I think they're getting some bad information from some of the elected here, not on this bench, but for other folks here in Sedgwick County. So, Mr. Papoon, today, could we form a committee to take a look at issues within Sedgwick County?
Commissioner Dennis, yes, there are a number of things that you could do under a charter commission that can currently be done by statute as well. I think some of the rumbling we're hearing from around the state is about the elimination of the county clerk, county treasurer, register of deeds office as an option for Sedgwick County with a charter commission. And this was, of course, done in Johnson County when they established their charter commission, and that is what has apparently some counties riled up. I think it's important to note that, one, these other counties, most of them would never achieve urban status or never even want urban status, and what they do in their county regarding their elected officials is fine for that county probably, but we have the authority to, for instance, increase the county commission from 5 to 7 members through statutory process, but that could also be done with a charter commission. We have the ability right now as a county commission to either set up a committee to look at it, or the commission on its own determine whether there are inefficiencies between the other elected offices and determine whether, because of those inefficiencies, we would put those functions under a county administrator or county manager and put that to a vote of the people, citizens of Sedgwick County. So many of these things we can already do under statute. Senate Bill 53 only gives us one more avenue to look into not only those issues but a number of other issues, and would be basically, those decisions would be made by a citizens group, many appointed by the county commission, but a broad base of citizens in this community to make those decisions and pass those along to the voters as opposed to county commissioners. So, I don't know.
But even if we decided to use the charter commission, we could do that today. We just have to send a bus to Johnson County and bring 25 people back, correct?
I don't know if you could find 25 people in Johnson County that would come down here, but yeah, maybe.
But it's already on the books. That's the point. Another question I got from my phone calls last night, what impact does this have on Leavenworth County and on Saline County?
Has absolutely no impact on these counties because it only applies to counties that have urban status. And now, this particular statute, a charter commission only applies to Johnson County and Sedgwick County if we can get it passed through the House.
Very good. So electeds contacting other counties and having them contact their elected representatives in the legislature saying that it's going to impact their counties is absolutely false information. Is that not true?
That's correct.
Well, I guess I'm just a little disgusted because we've been working this now since 2018. We have no intention to doing anything to harm anyone else. We don't even have a reason to use it. It's a tool that we're trying to put in our toolbox. We've been working since 2018. So for other electeds to try and undermine the Sedgwick County Commission, I think is just absolutely incorrect, and I am very disappointed. Thank you, Mr. Chairman.
Okay, Akeem, right, and Senate Bill 13, that's the one, the famous one about notices and all that on the property tax stuff? Okay. Okay. So that's been passed and is now moved in front of the governor for signature?
Yes, sir.
Okay. All right. Well, we better be ready to be fully transparent. Fully transparent, I might add. Okay. Any other questions, comments? I don't see any, so thanks, Akeem, for the update.
You're welcome, Chairman.
Appreciate you listing these out.
Yeah, absolutely, Chairman. Just one other point. I think there was a question about the lawmakers who also have a medical background, so I did send that to all commissioners, so you guys have that in your inbox as well, as far as contact information too. So.
You know, Akeem, in lieu of that as well, could you, that vote was pretty a majority, large majority, both the House and the Senate. Could you send the vote summary, whatever the vote numbers were to all of us?
Yes, sir. Absolutely.
So, okay, thank you. All right, next item, please.
Committee reports.
Does anybody have a committee that they, or a group they serve on for a report? I don't see any at this point, so, okay, well, Commissioner Dennis.
Thank you, Mr. Chairman. I appreciate it. And I'm sorry I spoke so often, but we're going to get word out to all the commissioners and everyone. We're going to have an opening at the zoo, the grand opening here coming up, and we will put out the word on when that's going to happen. We had a board meeting yesterday, and I was on Zoom, so I didn't catch the exact date, but it sounded like somewhere around May 21st, but I can't guarantee that. But keep your ears open because we're much looking forward to ribbon cutting to the new entrance to the Sedgwick County Zoo. Thank you, Mr. Chairman.
Okay, thank you. Any other questions? Comments? Don't see any. Okay, next item, please.
Other?
Others, anybody, any of the commissioners have anything other? I don't see any, so, Commissioner Howe.
Thank you, Mr. Chairman. I just wanted to invite folks that would like to speak with me. I am going to host a coffee this coming Friday at 1636 East Patriot Avenue in Derby. It's a church gymnasium from 7 to 9 a.m. It's come and go. I'll provide coffee, and you're welcome to come and ask me questions or simply listen in. Thank you.
Okay. Madam Clerk, next item. That's it. We do not have a fire agenda today, so we don't have an executive session. So we will stand adjourned until, potentially until Friday. Thank you.